Collie time in T-6.
please. Send her collie to the nurse's station. Send her collie to the nurse's station. Thank you.
Man, just as the song was starting to get good, too, I always time this so poorly. Every time the timer runs out right as the drop's about to happen. Oh, God. I gotta work on that. Guys, hi. Hi. Happy Monday. I hope you had a good weekend. I sure as hell didn't. That's because I worked. So at least I made money. Biko, what's up? Dude, Biko, it was fun watching you play the tank game today. Blowing up all them tanks. Good job. Good job. Biko, welcome in. Mr. Coles, welcome in. Binary split. Hold on. Shasta Dover? Am I reading that right? Dark blue. Okay. Dark blue is really hard to read on the night background, right? It's hard to read it on the dark background. Bands a lot broadcasting. Welcome in, Nuo. What's up? Saber, Het VC, the Mamba in there. Hey, welcome back. Snowy White Fox, I see you too. Flyzik. Everybody, Flyzik is the most fantastic food dog you'll ever meet. Also, he is pretty heckin' cute too. This is FY Shugaka. Hey, Fox guy, I see you all the way up there. Oh my God. Bendy Warp, you too. Jeez. Also, Broster coming up the tier 1 sub for 10 months, Broster. 10 freaking months. Holy crap. Almost a year. We're almost there. Oh, God. All right, hold on. Colt, I'll get to you in a second. Broster, you're covered under collie care from the bro to the toaster. You're a dog. You got flops. I got you covered. Spoke is a ghost. Thanks for the follow. Welcome to Fluffy Fuck. Welcome in. Colt, you guys. Colt coming up with the tier 1 sub for 2 freaking months. Colt, enjoy your uncommon sheep color. You're covered under collie care. From the flops to the beans, I got you covered. I want some coffee, damn it. Tasty as always. Tasty. That first sip feeling. Bri Fluff, hey, can I give you a big old virtual hug? Sure. Come here. Come on. Bring it in. Come on. I won't bite. Unless you want me to. Come on. There you go. I'm kind of happy that works. New Spider, thanks for the follow. Welcome to Floppy Flock. Welcome in. So good. Say coffee like you're from New York, then you can have coffee. What, like coffee? Is that how they say it? Like coffee? I'm not from New York. I don't know how New Yorkers do. I just know that they're rude and that their pizza sucks. Deep dish pizza all the way. Thin crust New York pizza. No. You know what you take with that thin crust New York pizza? In the trash, and then you pick up delicious deep dish Chicago pizza. Because it's ultimately superior in every way. Chef! Hug the heckin' cute collie, come on, bring it in. After we all get vaccinated first. Can you get a prescription for caffeine? I can't write prescriptions. I'm not a doctor. Okay, well, let me. I gotta address something real quick. Hold on. Phone, get out of here. I didn't give you consent, phone. Google trying to get in on my business. I get called doctor a lot. I gotta set the record straight. I am not a doctor. I never will be. I never want to be. I'm a nurse. Please don't call me doctor. Please don't call me doctor. It's like, I'm not. I'm a nurse. Doctors are crazy. But please don't call me doctor. Call me nurse. That's what I am. And don't call me Merce. I don't like being called Merce. Like a male nurse? No, I'm just a nurse. People are like, oh, what made you want to become a male nurse? Because becoming a female nurse was a lot harder. I'm just a nurse. Anyways, PhD in sheepology? If I ever go back to school, maybe. What is the difference between doctor and nurse? A lot. Doctors practice medicine, nursing practice nurses. Nurses practice nursing. We do, so the doctors write the orders and the nurses take care of them or fill the, complete the orders, right? So the doctor says, give this patient this much medication at this rate. And then I am the one who is to do that. That is my job. But it also is a lot more than that. I do blood work, I do IVs, I do assessments, I treat people, like I give medications, I do a lot. A lot. Lot. I don't even know where to begin. A lot. Pretty much all bedside care nowadays is done by nurses. You see your if you're in the hospital, you're gonna see your doctor like for maybe 30 seconds to a minute a day. Everything else is gonna be the nurses doing all of it. Giving medications, getting you up in the hallway, cleaning you, making sure you're turning, checking in on you, bringing you your food, all the fun stuff. H-Town Bite, thanks for the follow. Welcome to Fobby Flock, welcome in. I can do a nip from the barrel right now. Oh, of what do they keep? What do they keep? It's like whiskey, brandy, right? Some kind of dark liquor. Sounds pretty good right now. It's I mean, it's only 2:45. I could drink. I won't, but I could. Just start spiking my coffee. Nurse, I made a shit. Well, if you made it, you can clean it. You got hands. You're competent. You can clean up yourself. I do wipe a mean ass, though. I need 475 cc's of coffee stat. Yeah, me too. I'll let you know when I find some. Oh, wait. I already did. I'm drinking it. I prescribed myself 5.9, I'm assuming deciliters or deciliters, hazy IPA beer to be administered as needed for celebratory purposes. I can get behind that. I've given beer. I've given prescribed beer. I have a picture of it. We had a doctor who liked to order it for our alcoholics. To keep them from detoxing, we'd give them beer. And I scanned it up like I did every other medication. I had an order to give it. It was great. I gotta find the picture. Hold on. This was a couple years ago. Where is it? There it is. Beer from a pharma company and prescription packaging? No, it was just beer. I'll show you. I got the pictures right here. Hold on. Some kind of bops, though. There. Beer. With meals, beer. This is how the prescription, this is how the order was written in the chart. Beer, EO with liquid, with meals. It was like 3 times a day we give them beer. And then, the beer that they sent up to us, some good old Natty Light. Nothing says hospital quality beer like Natty Light. Natty freaking Light. Can you imagine? You're a hardcore alcoholic who your doctor doesn't want to give you benzos for to try to limit your withdrawal symptoms, and they say, don't worry, we'll give you some beer in the hospital, and you're like, hell yeah, sweet, I get some beer. And then the nurses bring in Natty Light. Like we're at some frat party in college. Yeah, there you go. I gave beer. I've also given cocaine. I have a picture of that too. Swab my nose with some? No. No. It's not for you. There. Cocaine! We use it for nosebleeds. Really, really bad nosebleeds, we use cocaine. 4% aerosol. Spray it up in there. What kind of toppings are you with pizza? I like pineapple on pizza, so let's just get that out of the way. I don't know, cheese, pepperoni, sausage. I'm not really picky. I like supreme pizza. Pretty much everything. I like everything minus like anchovies. I'm pretty much okay with just about anything on my pizza. I'm not a fan of anchovies. Does it get the patient high off of it? Not really. Maybe mild, but not a lot. It's not like it's not like sniffing pure cocaine. I thought you put a tampon up there when there's a bad nosebleed. Sometimes that doesn't help. Sometimes you actually got to put medications in there. We have like silver nitrate that we could put up in there. We have these giant sticks that we could put up in there that swell up and coagulate. And if it's really bad, we use cocaine. Or if the doctor wants cocaine, we just give him cocaine. Hence why cocaine is a level 2 drug, a Schedule 2 drug, because it has some medicinal abilities. Anyways, on top of the fact that I've given liquor, cocaine, opioids, benzos, basically meth, if you consider like Vyvanse and Adderall meth, right? And I've given Marinol, which is synthetic THC, so I've pretty much given every major class of psychoactive drug you can think of, minus like psychedelics like LSD or psilocybin. You ever think it'll be ever a Schedule 2 drug? I think it'll be decriminalized or legalized at some point in the future. If you're asking me legitimately, I think in the next 5 to 10 years, we'll get there. It'll be just like drinking and smoking cigarettes. It'll just kind of become colloquially acceptable. Had 3 tabs of acid in a nice room to chill in. Stat. Doc, I don't feel so good. Oh, I see shapes and fractals. The research is getting there. You'll probably give LSD to depressed people. Yes, I know. I've heard that psychedelics, I believe psilocybin, which is in magic mushrooms, has been shown to, preliminarily, been shown to help with depression. That doing like medically guided microdose trips can sometimes help with depression. It's not been published, or if it is published, it's not been widely accepted or criticized yet. It's very, very infant stages of this, but apparently it works pretty well. Something about the way that it alters your brain and perception, it helps. I'm not sure how. Like, I know, for example, currently, there are doctors who are using ketamine, which is a disassociative. They use ketamine to treat depression. You can go in and get microdoses of ketamine and have a therapy session. And apparently it's pretty good. Apparently it helps. It's being used in Oregon, really. I'm curious as to see what's going to happen with the future of medicine. Everything advances for a reason. Medicine advances super quickly. Eventually, we're going to get to the point where we understand a lot more than we know now, and we already know a lot. All right, guys. What would happen if you made somebody tripping acid play Phasmophobia? They'd probably lose their shit. They would probably... first of all, if you could even get someone who's tripping on acid to look at a screen long enough to play Phasmophobia, which I think is going to be your first challenge, then they would probably lose their shit. But actually just getting them in VR to begin with is probably going to be pretty difficult. If you've ever been around anyone who's been on LSD or psychedelics, they don't particularly care to look at screens. The theory is that psychedelics, dissociatives allow the mind to break hardwired circuits of trauma and depression to form new pathways. Interesting. Interesting. It's actually kind of cool. Okay. Today, we're going to talk about diseases of the heart. I've done a lot of lectures about just general anatomy and physiology, right? How the body works, why it works, and what happens when things go right. We haven't spent a lot of time talking about what happens when things go wrong. which is half the battle, right? Knowing what's going, you got to know how things work first before you can understand how they break, right? I can't tell you that an abnormal heart rhythm affects the way that the heart pumps if you don't understand what a normal heart rhythm is, right? You can't understand how an abnormal heart valve affects the body unless you know what the heart valve is to begin with, right? So you got to have the basis of anatomy and physiology first before you start talking about the changes and some of the damages and diseases that can happen to our bodies, because our bodies are very fragile.
Shazbot!
Thanks for the host, guys. Shazbot. Shazbot. Woohoo! Shazbot. Oh, actually, that one timed up pretty well. But, real quick, before we start, I need to get more coffee. I ran out. I gotta go pour myself a fresh cup of coffee. Hold on, I'll be right back. Hold on. Right back.
Woohoo! Shazbot!
What you looking at? No, you ain't looking at me. I see you. Oh god, I can pick up my face all the way back there. Holy crap. What do we do to offend Cinder? Nothing. I just like making him look angry when I leave. There we go. Cyber Panda, thanks for the follow. Welcome to Floppy Flock. Welcome in. Now, I got some coffee. I got another like half cup of coffee to go with the full cup that I just finished. Server Reaping, thanks for the follow. Welcome to Floppy Flock. Welcome in. The Minecraft sheep noises? Yes, they are Minecraft sheep noises. Have waffle, thanks. All right. You guys ready to learn? Are you ready to sit down? Are you ready to shut up, pay attention, and put that ass in that chair, because it's time for class. If you're late, I'm gonna call your parents. If you're eating in class, you're gonna get embarrassed. You don't pay attention, then you're gonna fail. You got no one to blame but yourself. Otherwise, sit back, relax. Let's start exercising that brain. After a quick stretch. KK.
Cinder 7 flop, Cinder 7 flop, Cinder 7 flop.
Cinder 7 flop, Cinder 7 flop. KK coming with the tier 1 sub for 4 freaking months. KK, you're coming under colic here, from the icing to the spongy cake. I got you covered, and you're probably delicious, I'm sure. I just take a little lick. Nip, nip, nip. Little lick of that icing. What flavor cake are you? Are you funfetti? I hope you're funfetti. I have food and I have enough for the class, then share. What you got? What you got? Come here, come on. I want some. Come on. Please? Right here. Put it right here. In the hand. Please? Please? Whatever I want. You're whatever type of cake I want. Fine, your funfetti cake. I have a note from my doctor that says I have narcolepsy, so if I fall asleep in class, you can't get mad at me. I can get mad at you all I want. A note doesn't control my emotions, but also try to stay awake. Banana bread and pudding. Ooh, that sounds good. Do I remember the cake meme? I do. Talking about the knife that turned everything into cake. I remember that. Guys! Heart disease! There are a lot of heart diseases. We're going to talk about some of the most basic ones or some of the more common ones. And then I threw a few fun ones in there that I want to talk about that I think are just interesting. That we'll talk about at the end. You really need to get you a graphic tablet to write? No! I like it this way. Although it probably would help, but I like it this way. Plus, I don't know where. I guess I would put it like right here. I guess that would work. I don't know. I should probably just splurge and get like a $100 tablet or something and just get it over with. I put enough money into the. I've invested enough money into the stream. I might as well just do it. Does too much cake cause heart damage? It probably will over time. Do not buy me. Okay. Hold on. I'm gonna say this right now to all of you. Do not buy me a tablet. I will get my own. I will. It'll happen. I'll do it. I'll do that. How about I'll do it after stream? Let's see. How much? Let's go to Amazon real quick. What you got for drawing tablets? Yeah, I can get one for like $50. It doesn't have to be great. Yeah, that could work. I'll do it at the stream. Forget till next stream. Don't call me out like that. I'm sorry. I got scatterbrained. I'm a dog. What do you want? Look, this one is. I don't know. Is this probably some knockoff Chinese company? Huion, Huion. It's like $50. Is that even worth it? I can get a Wacom. I prefer getting a Wacom. That'll work. Oh, this will actually work well. Okay. Huion is good. It's good. What about Wacom? It's a little bit more expensive. Get an iPad Pro? Nah. I'll go with the Wacom. It's only $70. Got good ratings. It looks like it's small enough that it'll fit in a really good spot on my desk. Yeah, that'll work. All right, guys. Finally, it's happening, and it'll come tomorrow too. So which means I might be able to get it set up tomorrow. If not tomorrow, then I'll have it for Wednesday stream. There, it's done. It's ordered. Are you guys happy? Are you happy that you made fun of my handwriting enough to make me want to get a tablet? I gotta turn the fan on. Hold on. I'm getting hot. I'm getting hot and bothered. I'm having to buy tablets and electronics. Finally, Serum. Yes, it is probably finally 10 months into streaming and lecturing YouTube. Oh my god! Dude, Broster coming out the tier 1 5 gifted tier 1 subs to the community. Holy freaking crap, Broster. Why are you so kind? Thank you, Broster. Thank you for those gifted subs. I appreciate it. Holy crap. Alabaster, Online, Wallenberg, Panther Finn, and Branch Logic. You guys are all coming under collar here thanks to Broster. From the flops to the beans, I got you covered. Holy freaking crap, Broster. Thank you. I don't even know what to say. 48 gifted subs. Thank you. So nice. He might not be a doctor, he's got the handwriting of one.
In celebration of your new tablet.
Broster, thank you. Thanks for the 100 bits. Thanks for making Tux dance. Look at that werewolf. Quality USDA Prime werewolf. I appreciate it. Thank you. You didn't have to do that, though. You really didn't. I do appreciate it, though. Also, DC Flash. My handwriting's better than doctors. I can promise you that. All right. Are we ready? Are you guys ready? You guys ready to learn? Are we done? Are we ready? You guys ready to pay attention? So, we're going to break up our heart diseases today into two primary branches. There's going to be electrical and structural. Now, I've done lectures in the past about EKGs and structural issues with or electrical issues with the heart. I'm not going to go into too much detail with it today. We're going to talk about the two of the more common ones that we see. Hello.
I do want to subsidize part of the purchase though. You are such a good teacher and a good dog and deserve it. 333.
Dude, no, I'll come out with 100 bits. Thank you. That's so kind. Thank you. I am just happy that you guys enjoyed learning and that my crazy sense of teaching actually clicks with you. I appreciate that. Thank you, Noah. Thank you, thank you, thank you. Ah. I don't even know what to say. The generosity is so... You guys are so generous. All I am, I'm just a dog who likes the human body and thinks it's fascinating. And I like talking about it because nobody ever shuts me up. They just let me keep talking. I'm like, let me tell you about this cool thing that your heart does. And everyone's like, okay, Cinder, you just keep talking. I'm like, it does blub, blub, dub, blub, dub, moves blood around, blood goes blub. And everyone's like, oh, Cinder, good job. Oh. Prime Werewolf, where do you get one? Preferably the Werewolf store. You gotta get them on the Werewolf store. Hold on. Oh, a Woozamon? That sounds like a Digimon. Like Amazon, but a Woo. I don't know. Wait, let me see. Let's see. We got Amazon. You do like a Woozon? No, that doesn't work. I don't know. I'll come up with something. I'll come up with something. Sometimes you just gotta brainstorm. All right. Let's get started. You guys are way too kind. Way too kind. All that I ask is that you wear your fucking mask. There, I said it. A Wooazon? I guess that works. Werewolves Are Us. Well, what next game will be after Superliminal? Turing Test, I think is what I was planning on doing. Okay. So we're going to talk about two kind of branches of heart disease today, electrical and structural, right? So electrical disease or electrical heart disease are going to be diseases of the electrical impulses of the heart, right? Remember when we talked about the heart, we talked about the fact that there is this electrical kind of like wiring throughout the heart that causes it to beat, that causes the muscles to contract, but it also causes them to contract in a coordinated manner to help move blood around the heart, right? Obviously, disruptions in those electrical signals can cause disease or problems of the heart, right? We're going to talk about two today. We're going to talk about AFib and third degree heart block because those are the ones that require usually the most treatment outside of the other ones that require you to be shocked and whatnot. And then we're going to talk about some structural heart disease, things like congestive heart failure, valve disease, heart attacks, pericardial effusion / cardiac tamponade. And then we'll talk about some fun diseases like tetralogy of Fallot and transposition of the great vessels. And then my favorite, which is Takotsubo's cardiomyopathy, which is just a funny, not funny, but like a really interesting temporary heart issue that we'll talk about if anyone's ever heard of that. Me and the chief advisor to the board of directors wore our masks for an entire conference call to New York. I don't get people who say they can't be heard or hear. I wear a mask all day, every day at work, and no one's ever had a problem hearing me talk. And if they do, I just yell at them, which is great. ECMO. We're not going to talk about ECMO. Although that would be, ECMO is, I don't think I've ever seen ECMO. Maybe once, twice. I know, Jake, you're in the ICU. You probably see ECMO all the goddamn time. We don't generally do ECMO down in the emergency department. All right, so let's start with the electrical ones first because those are kind of the more dry ones. We've talked about them before. Talk about atrial fibrillation or AFib. Who knows somebody who has AFib? You're an ECMO nurse. Oh, you are actually just a straight up ECMO nurse. Nerd! But also, that's pretty freaking cool. Evil Phoenix, thanks for the follow. Welcome to Bobby Flock. Welcome in. I'm ready to apply an AED to my work PC. The database won't let me in. Well, then you're just going to fry the PC. What's ECMO? What is it? Like extracorporeal extracorporeal membrane oxygenation. It's life support. It's when we bypass your heart and your lungs, essentially, and oxygenate it. It's life support. All right, so AFib. So if you remember briefly when we talked about the conduction of the electrical conduction, or the electrical signals traveling through the heart, I told you it started in the SA node, which is up in the atrium, conducts through the atrium down to the AV node, where it is then held for a second and then continued on to the ventricles, right? You should only be receiving electrical impulses in the atrium from one spot, and that is the SA node. Sometimes what'll happen though is you'll get these electrical impulses that just start originating in random spots around the atrium, right? So like if this is your SA node here, now you're getting an electrical impulse here, an electrical impulse here, 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 here. And what all these extra impulses do is it prevents the atrium from having a solid coordinated contraction. You get what we call fibrillation, right? So if your atrium should contract nice and easy like this, when you're in AFib, your atrium's kind of like they quiver, right? They don't contract fully because there's too many electrical impulses hitting from too many different areas that there's no coordinated contraction. They just kind of quiver, right? And they don't really move blood that well. Some of the symptoms of AFib, one of the main ones that people are going to feel is going to be palpitations, so fluttering in the chest, right? But palpitations, right? They might also have some chest pain or pressure, right? Some lightheadedness or dizziness. They're going to be short of breath, right? Gage with the 5 bits. Thanks for the bits. What am I doing? I'm teaching. We're teaching. I upped the bit alert to 10 bits because too many people were abusing the 1 bit. I upped it to 10. Just an FYI, but thanks for the 5 bits. I appreciate it. Thank you. It's all not in sync. Correct. There's no synchronized, there's no coordinated contraction. It's just quivering, right? So some of the symptoms that you'll get: palpitations, chest pain, dizziness, shortness of breath, what we call dyspnea on exertion, or shortness of breath that's worsening when you exert yourself, right? They also might feel some fatigue, as well as just feeling like they kind of get anxious, right? One of the biggest concerns that you have with AFib is what we call rapid ventricular response, or RVR, which is when these errant impulses start conducting through the ventricles, right? So normally these impulses just stay up in the atrium, right? And the atrium just quivers away, just kind of does its thing, right? And then the blood gets pulled in when the ventricles open up because the pressure in there kind of pulls it in. So you're still getting some blood flow. What'll happen though is sometimes all of these impulses will conduct through the ventricle, and then you get heart rates in like the 140s, 150s. That's a medical emergency that needs to be treated. Running Paul, hey! Gurglerg, hey Gurglerg! Gurglerg! What's up? I have a doctor's note that you borrowed from Bandy. Does that excuse me? I don't know. You're acting kind of sus. Why were you seeing Bandy? Bandy's what is he? Does rehab. Why are you over at rehab? Medical rehab? What'd you do to your spine? Huh? Toxin doesn't dance for single-digit cheers? No, he's a high-class werewolf now. You fell on a Lego? Okay, that actually sounds pretty painful. I'm sure they alerted the trauma team when that happened too. Some of the treatments for AFib, typically we're going to treat with medications. There's a couple medications out there that we give for this. You have cardizem and amiodarone. Right? These are medications that are to help slow the heart rate down, but also help convert the heart back to a normal rhythm. Right? In the emergency department, we like to give cardizem, and it works pretty well. You can also use things like beta blockers, as well as anticoagulants for these patients. Because the other main risk with AFib, outside of that rapid ventricular response that I talked about, is when you have blood that's just kind of pooling up here in the atrium, right? So remember, the atrium is not contracting completely, right? So sometimes you're gonna get some blood that's gonna pool up in the atrium. Well, what can happen is when you get blood that's hanging out together for a long time, eventually it's going to clot. And then you can have a clot that breaks off, gets down into your left ventricle, and then out into systemic circulation, causing possibly a stroke or a heart attack. We put these patients on anticoagulants medications like Coumadin, which is warfarin, Xarelto, Plavix, Brilinta, Eliquis, right? These are all blood thinners that we place patients on to help prevent those clots from forming within their hearts as their atrium fails to contract completely. All right, we diagnose this based off of an EKG reading, which looks different than like a normal heartbeat, and it's something a doctor can diagnose. Treatments for this outside of medication, we can also do what's called a cardiac ablation. A cardiac ablation is when they surgically will go in and actually burn the areas where these electrical impulses are originating as to ablate them, to burn them or damage them enough that they can no longer produce electrical impulses. So they'll actually go in and just burn it and ablate it. The other treatment for this is if it's in an emergent situation, we can do a cardioversion, which is a synchronized defibrillation almost of the heart. Kanai the Cute Bear coming with the raid of 2. Dude, thanks for the raid. Welcome in, the 2 of you. Thanks for blasting my ears for a wonderful Andrew WK, and thanks for sharing your community with mine. What's up? What are you guys doing? What are you playing? Elsack Boy, thanks for the follow. Welcome to Flobby Flock. Welcome in. Cardioversion. So if you are in AFib RVR, so your heart rate's super fast, and you're unstable, which means that like your vital signs are bad, or you're unresponsive, or you have some changes, we will do what's called a synchronized cardioversion, which is a timed, it's a timed shock at a very specific point in the heart rhythm to try to reset it. All right. I won't go too much into AFib because it can get really complex with some of the things that can happen with it. Third degree heart block. So when we've talked in the past about the electrical channels of the heart, right? And I've talked about this already today, and we're going to talk about it again. Impulse travels from your SA node through your atrium down to your AV node, where it is then held and sent down into the ventricles, right? This is what causes your heart to contract in a coordinated manner, right? Thurix, thanks for the follow. Welcome to Floppy Flock. Welcome in. What happens in third degree block is you have a right about in here, somewhere between the SA node and the AV node, there is no communication between the two, right? So the SA node fires at its normal rate, and the electrical impulse causes the atrium to contract, but for whatever reason, the AV node doesn't pick it up, so it can't conduct it through the heart. So the AV node then sits there and goes, holy crap, I haven't gotten an electrical impulse in a while, and it starts to originate its own, because it is a pacemaker of its own, and it can originate its own impulse, right? So what you get is an uncoordinated beating of the atriums and the ventricles, where your normal rhythm would be beat, 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 right? So if this is my atrium, this is my ventricle, right? Atrium contracts, ventricle contracts. Atrium contracts, ventricle contracts, right? You should have an atrial contraction for every ventricle contraction, right? What happens in third degree heart block is you might have this one just beating along normally, right? And then the ventricle just kind of does its own thing at its own rate, and there's no coordination between the two, right? Whereas before it was 1 2 1 2 1 2, right? And third degree AV block or third degree heart block, this is just going to beat on its own rhythm, and this is just going to beat at its own rhythm as well, right? You have no coordination between the top and the bottom of your heart. This is diagnosed via an EKG reading, which looks something like this. What you can see here is if you look at the markers here, these are your atrial contractions, right? These are what we call your P waves. And then the big QRS complexes here, these are your ventricular contractions. Nadaski, thanks for the follow. Welcome to Flobby Flock. Welcome in. So you can see there's no real coordination. This is just going to beat at its own rhythm, regardless of what the ventricles are doing, right? And then the ventricles are going to beat at their own rhythm, all right? Some of the symptoms of third degree heart block, all right? Lightheaded, dizzy. You're going to see a lot of these symptoms are going to overlap, by the way. They might be dizzy. They may be fatigued. They might have some bradycardia or slow heart rate. Right? Some chest pain, maybe. And then just general feeling like crap, right? Because when your ventricles contract, they're only contracting at a rate of about 40 a minute, So your heart rate's going to be around down in the 30s and 40s. And you're going to feel like crap because of it. What's up, Cactus Ugly Cactus?
Oh well, will you look at that? How do Cinder?
Cactus
Cinder
Ugly
7
Cactus.
love.
Coming out the tier 1 sub for 10 freaking months, Cactus Ugly Cactus. I see that founder's badge. You have been so freaking kind to me. Oh my god. Cactus Ugly Cactus. You're coming under collie care from the prickly thorns to the mulch in the pot. I'm not gonna snuggle you because you're a cactus and it'll probably hurt. But I appreciate your support, and there's a reason why you got that founder's badge, because you've been here since the start. Thank you. Alright. Does anybody know what the treatment for third-degree heart block is? Also, real quick, before we move on to what can the treatment for this. Some of the complications. The biggest one. Cardiac arrest is the biggest one. Electricity, Pikachu therapy, kind of. Smaller. Small electricity. Small electricity. About the size of a pack of cards. Maybe even smaller. That we implant into your chest. A pacemaker! Yes! A pacemaker! Treatment for third-degree AV block is a pacemaker. If your pacing cells don't want to work in coordination, well, guess what? Then we'll just put a device that does work in coordination, and we give you a pacemaker. So a pacemaker is a little device that's implanted, usually in the left side of the chest here. Wires are fed up through the subclavian vein down into the superior vena cava, and then these electrodes are implanted into the heart wall muscle, or the heart muscle, where electrical impulses are then conducted from the pacemaker into your heart to take over for your pacemaker cells. Circle! Hey, Circle! The heart is not a place to have fun and be yourself. No, your heart should be coordinated. It should be uniform and coordinated. No individuality in the heart. The heart needs to work in coordination. So that's the treatment. Third-degree AV block needs to be treated with a pacemaker. If it is bad enough and you are symptomatic, we can do percutaneous pacing, where we actually just put the defibrillator pads on you, and we can set it to a pacing mode, and we can pace you through your chest. Hurts like hell, but it's better than dying. Do they still make pacemakers that have hackable wireless connections? I hope not. Your heart is how you feel feelings. It is not. Your heart has no control over your emotions. That is all your limbic system in your brain. Your heart does one thing, and it does one thing well, and that's pump blood. If you were to give the heart any other task other than to pump blood, you are inappropriately assigning tasks to the heart. Its only job is to pump blood. Your feelings do not come from your heart, they come from your brain. Which is why we have control over our emotions. It doesn't come from anywhere else other than our own brain. Heart's got nothing left to do with it. When she left me, she broke my limbic system would be the more accurate way of saying it, D. Brendan, but unfortunately, there are no songs about the limbic system around Valentine's Day. There are only songs about the heart. The heart does not want what the heart doesn't know what it wants. All it wants to do is pump blood, and to give it anything else, it does not multitask well. It only does one thing well, and that's pump blood. So stop blaming it for things. All the heart wants to do is pump blood. Stop blaming things on it. It's not the heart's fault. I think most modern pacemakers are shielded against outside interference. I believe they are. I'm not 100% sure, though. Exelholf, hey! Alright. That's the boring electrical stuff that we were going to talk about today. Now we're going to get into the fun structural stuff. So yeah, there's a lot of electrical signals that go through the heart, but the heart is, at the end of the day, a giant pump, right? And not only can the wiring break, but all the actual mechanical parts of the heart can break as well. You know what's going to be funny is when I get my tablet and you guys realize that my real life handwriting is just as bad as my mouse handwriting. You guys are going to be disappointed. ATV Rob, thanks for the follow. Welcome to Follow Me Flock. Welcome in. Mecco9, thanks for the follow. Welcome to Follow Me Flock. Welcome in. Heart rate can influence emotional state, but the other way around is also a thing. It can, I mean, the feeling, right, of your heart racing, you get that fight or flight mode, right? That's what, you know, when you start getting like that racing heart, that anxiety feeling, it's your fight or flight system kicking into gear, right? And that'll increase your heart rate, which will then make you feel more panic, which will then increase your heart rate more, right? It's a cycle. But your heart does not control your emotions, your brain does.
And you say you don't want to be a doctor, your handwriting says differently.
Wow! Wow! Called out on Twitch.tv during my own stream! Broster. Okay, that was actually pretty funny. Thanks for the 100 bits, Broster. I appreciate it. Thank you. Got him! Got him! Not sure achy breaky limbic system gonna be a hit. Maybe. I think we can work something with that, right? I still say my whole heart is a multitasker, and I'm gonna say that it's not. It's not! Are we moving on to heartburn after that? Heartburn is not a heart issue, it's a gastrointestinal issue. Acid reflux. Alright. Put a 1 in the chat if you know someone who's got congestive heart failure. Put a 1 in the chat if you know someone who's got congestive heart failure. I actually see a lot of 1s in there. Very common heart disease. My boyfriend's mom went to the hospital for CHF. And I will show you the shape of my limbic system. The quickest way to a man's limbic system is through his brain and food. Good, there are some ones. Okay, let's talk about heart failure. So congestive heart failure occurs when the strain on the heart becomes too much, right? So let's take, for example, blood pressure. So if you have high blood pressure, right? If your blood pressure, the pressure in your arteries and your veins is consistently high, right? This can be due to poor diet, right? High salt in your diet. Straight tail. H-E. Adult. Straight tail, thanks for the 100 bits. Thanks for making Tux dance. Look at that werewolf. Quality werewolf. So if your blood pressure is high, right? And there are a lot of things, like I said, that can cause high blood pressure. Old age, obesity can cause it, poor diet, diabetes, right? Excess stress can cause high blood pressure. When the pressure in your arteries is high, your heart has to pump harder to overcome that initial pressure to move more blood. Okay, that is the key thing here. Your heart has to work harder. It has to contract harder. It has to squeeze harder. It has to make more force to get blood circulating when the pressure is high. Does that make sense? Well, like every other muscle in your body, the harder your heart has to work, the bigger it gets, right? And as the heart gets bigger, it becomes less effective. You get what's called cardiomyopathy. Cardiomyopathy is essentially an altering of the heart muscle, right? So you can have dilated cardiomyopathy, and you can also have hypertrophic cardiomyopathy, right? They do the same thing, or they achieve the same goal, which is impacting the ability of the heart's muscle to function, but in two different ways. And how that happens depends on the disease process that you have. But ultimately, it affects the muscle of the heart enough that the heart can no longer adequately eject blood from the heart to the rest of your body, and your body begins to suffer for it, okay? So that is kind of the process of how this works, right? So let me show you a picture. So here is some heart failure. This would be hypertrophic, right? So if you think of the term hypertrophic, hyper meaning like bigger or higher or more, right? And then trophic, it's going to be getting bigger muscle, right? If you think of like atrophy means to lose muscle or like no muscle, hypertrophic or hypertrophy means to get bigger, right? I thought exercising the heart muscle was good. It is good. There's a difference between like doing cardio exercise, right? Where you're actually like straining the heart muscle in a way that's making it more effective. But if you have high blood pressure or consistently high blood pressure, the heart has to work harder to overcome that. It's different. It's a little bit different. When the Grinch's heart grew 3 sizes that day, he came much closer to death by cardiac hypertrophy, pretty much. Yeah, actually, yeah. So when people tell you they have big hearts, it's not a good thing. So on the left side here, you're going to see a normal heart, right? You see you got the walls of the ventricles here are nice and thick, but not too thick that you still have a pretty good amount of space within that ventricle to contract, right? And it can still snap closed, right? It can still contract closed. Now look at your congestive heart, right? You see how thick this is in here? You see how thick the wall of the ventricle is, right? And look how much little space is in the ventricle compared to a normal heart. So not only do you lose the contractility of the muscle, but you also lose actual filling space. So not only do you have less blood coming into the ventricle, but it also can't contract hard enough to get it all out. Maybe thick, right? So this is how I like to describe it, okay? Stick your arm out, take your right arm and stick it out to your side, like you're T-posing, but with one arm, right? Go ahead, do this. If you're sitting down, do this, okay? Pretend you have a balloon on your bicep, okay? Now take your hand, bend at the elbow, and touch your shoulder, and try to pop that balloon, right? So if you had a balloon kind of in the triangle between your bicep, your upper arm, your forearm, and your shoulder, try to squeeze that, right? That is your ventricle, okay? That motion there, that is the ventricle. That is you squeezing, right? And if you can squeeze and pop the balloon, congratulations, you got a nice healthy heart, right? Now, think of a bodybuilder, someone who is absolutely massive. I'm talking massive forearms, massive biceps, massive shoulders, right? If they were to try to do that, they could not touch their shoulder, right? Their muscles are too big that they cannot touch their shoulder, which means they cannot get a good enough squeeze to pop that balloon. Does that make sense? So while a normal person can do that, squeeze just fine, get a nice good, coordinated squeeze. If your muscles are too big, you can't actually complete that. You can't squeeze. You can't contract. Does that make sense? That's what we call hypertrophic cardiomyopathy, or an enlargement of the wall of the ventricle. Okay. Now I'm going to throw you another one. What we call I'm forgetting this. Is it dilated? Thank you. That's the word I was looking. I had to look it up because I had a brain fart. Now we can talk about dilated cardiomyopathy, right? So if hypertrophic cardiomyopathy causes a thickening of the wall, dilated cardiomyopathy causes a thinning or a ballooning out of the ventricle, right? So once again, if you look at your normal heart, right? Nice big space in there, nice thick walls to be able to contract. Now look at this one right here. Very narrow walls, right? The ventricle has ballooned out. The walls have shrunk or been stretched, right? They've been dilated, right? So now you have this dilated atrium or ventricle that can't contract either. So using the same analogy, right, of trying to pop the balloon between your shoulder and your arm. Imagine someone who's just super skinny, right? Skin and bones. They got no muscle on them. It's just bone on skin, right? The skinniest person you can think of. If they tried to do the same thing that we're doing, they might not be able to get enough force to actually physically pop the balloon. They are not strong enough to apply enough force to squeeze and pop that balloon, right? So a normal heart can work great. They can touch their shoulder. They can pop the balloon. Everything works great. Hypertrophic cardiomyopathy is your bodybuilder who can't get a good enough squeeze because of the fact that their muscles are too big and they have less space in there and they can't squeeze it shut. Your dilated cardiomyopathy is going to be your skinny, really weak kid who can't actually squeeze hard enough to pop the balloon. Does that all make sense? Am I just talking out my ass, or does that all make sense? Because that's how I think of it. This is how I imagine it in my head. Cinder Nerd Wed, next time I get emotes. So, there's a couple things that can cause this, right? So causes of congestive heart failure are going to be high blood pressure, maybe some kind of heart valve disease, right? Congenital defects or congenital predisposition to this can also cause it. Old age can cause this as well. Primarily, it's going to be like your high blood pressure is going to be probably one of your biggest risk factors. Now, what happens with this? So, we've talked about before in the past what happens when your heart doesn't, I've briefly touched on what happens with CHF before in the past, but we're going to talk about it again now. So, when either of these, your diastolic or your systolic heart failure, what's going to happen is you're going to get a traffic jam in your heart. Okay, so let's stick with the hypertrophic, so diastolic, your hypertrophic cardiomyopathy, right? Because you have a smaller space in here to fill, and because you're not ejecting enough blood out, right? What's going to happen is the blood's going to start to back up, right? So blood is still coming in from the lungs as it normally would, right? But it's not leaving. So say if you're getting, I'm just going to throw some random number. Say it's a ratio of 2 to 1, right? Where normally it would be 1 to 1, where you got, the amount that's coming in is the amount that's going out. With heart failure, you're going to get more blood coming in than what's being pumped out. The heart cannot keep up, right? So what happens then? The blood backs up into the atrium and it backs up into the lungs, right? The first place you're going to see swelling is going to be in the lungs. You're going to get what we call pleural edema, right? Congestion in the lungs. This can cause some shortness of breath and difficulty breathing, right? Especially as you start to get more and more congestion in the lungs, that fluid starts to then actually seep out of the vessels and into those alveoli sacs, into the lungs, causing shortness of breath and respiratory issues, right? So they're going to have some shortness of breath. Now, if it continues to get worse, then the blood's eventually going to back up to the right side of the heart. And then what happens on the left side of the heart is going to happen on the right side. Now suddenly your pulmonary circulation, the pressure in your pulmonary circulation is increased, which means the right ventricle is now going to have to work harder, and you're going to end up with heart failure on both sides of your heart. When that happens, it then backs up into systemic circulation. You start getting some of the systemic symptoms. Swelling in your feet, right? Massive, I'm talking massive swelling in the feet. They look like the Michelin man sometimes. You get these huge swollen legs, right? Swollen peripheries, so your hands become swollen as well. You feel fatigued and tired because your heart cannot keep up with the demand of your body for oxygen and blood, right? You might have some palpitations. You might have a cough because of the congestion in your lungs, right? These are all going to be symptoms of congestive heart failure. The shortness of breath, cough, swelling, chest pain, fatigue, dizziness or lightheadedness, right? And you might even, if it gets really, really bad, go into some kind of cardiac arrest. Y2J, hey! What do we do to correct congestive heart failure, Professor Cinder? I am getting there. That'll be the next thing I talk about once we finish this up. Oh baby, we're learning. Thought school is out for today, but what the heck? What's a few more hours? Good! Stretch that brain muscle of yours. It's exciting. So how do we treat congestive heart failure? Right? So there's a couple things we have to do. We have to take stress off of the heart, right? So we need to lower your blood pressure, and we need to get some fluid off of you, because now you've become hypervolemic. You've become overloaded with fluid, right? Hypervolemic, too much volume, right? So what do we give you? Does anybody know what a diuretic is? Can anybody name a diuretic? If you know anybody who has congestive heart failure, you're probably pretty familiar with what a diuretic does. I spend hundreds of thousands of dollars on a doctorate, and we can have a fluffy dog teaching medical stuff on Twitch because I'm not an actual professor. I just do this for fun. You're going to learn a lot more in school. They make you pee, yes. Diuretics make you pee. So you're probably asking, well, why do we want to pee, right? Well, diuretics like to make you, they draw fluid into your nephrons, right? They draw fluid out of your blood that you then urinate out. If we can take fluid off of you, we can lower your pressure, your blood pressure, right? Because less volume equals less pressure. So if we can take some of that volume off, we can lower the blood pressure and reduce the workload on the heart. Does that make sense? Some of the common ones, you got your Lasix or furosemide, your hydrochlorothiazide, HC, right? Spironolactone. Right, these are all diuretics, things that are going to make you pee, okay? Now, there are other medications we can use called inotropes, right? Positive inotropes or inotropic therapy, right? So medications like dobutamine and milrinone These medications are known as inotropes or positive inotropes. What they do is they increase the contractility of cardiac muscle, right? So yes, this heart muscle wall might be thicker, but we can make it more contractile. We can make it snap shut quicker, right? We can give you a medication that's going to make it close quicker to increase the amount of blood that's being ejected out of it. This is called inotropic therapy, and there's a few medications that we use, primarily dobutamine and milrinone. These medications are usually used in severe congestive heart failure exacerbations or in the hospital. Sometimes patients will be sent home on some kind of inotrope, but majority of the time patients are going to be receiving this intravenously in the hospital. And then the other treatment is blood pressure control. So short-term treatment, these are going to be your short-term treatments for really, really bad congestive heart failure. This is really bad. If you get put on dobutamine or milrinone, that's really bad. Your diuretics, though, are going to be some of your chronic treatment for congestive heart failure. Congestive heart failure is a hard disease to manage because you're going to be peeing a lot, and a lot of patients have fluid restrictions. They can only drink so much fluid to prevent that overload of fluid, which is going to stress out their heart. My grandma has to take medication for her cholesterol. How does it work, though? I don't know. You should look up statins. She's probably on a statin, like a torvastatin, simvastatin, or rosuvastatin. It's a cholesterol medication. Just look up how they work. So your diuretics are going to be for your chronic kind of long-term use. Your dobutamine and your milrinone, which are your inotropic therapy, is going to be more for short-term use. Okay? And then obviously on top of this, you want your BP meds, your blood pressure meds, right? Because if you can keep the blood pressure down, you can reduce the workload on the heart. Some of the complications that can occur with congestive heart failure, well, obviously cardiac arrest is going to be a big one, right? You can have worsening valve disease because of this, because you're increasing the amount of force that has to be used to open up and push past those valves. But also long-term, this can cause damage to your kidneys, because high blood pressure is going to cause damage to your kidneys. Can it be genetic? It can. There are what we call modifiable and non-modifiable risk factors, right? So for example, age is a non-modifiable risk factor. There's nothing you can do to modify your age. Smoking is a modifiable risk factor because you can modify your behaviors and stop smoking, right? Diet is a modifiable risk factor. Exercise is a modifiable risk factor, right? Genetics is a non-modifiable risk factor. There's nothing you can do about it. But what you can do is you can focus on the modifiable risk factors and try to change your lifestyle to prevent it if you're genetically predisposed, right? You have to work on, you got to hedge your bets, right? So if you're genetically predisposed to, why do I feel a breeze? If you're genetically predisposed to heart failure, then you need to do everything in your power to modify your lifestyle to prevent it and do the best that you can. Can a congestive heart also be linked to salt? Because salt, yes. Salt, high salty diet means more salt in your blood. Water follows salt. So if you have a lot of salt in your blood, you're going to get a lot of fluid in there from your cells to try to dilute out that salt, which causes, once again, more volume, more pressure. So yes, high salty diet and a poor diet can lead to congestive heart failure over time. Now, generally speaking, congestive heart failure is something that's going to progress over time. You might not realize you have it until the symptoms start to appear, in which case there's a possibility enough damage has been done that you then have to manage the symptoms instead of actually fixing it. Any questions about CHF before I move on? It's a very common disease. The important things to note is that congestive heart failure causes a altering of the structure of the heart wall muscle, known as cardiomyopathy, either through hypertrophy, which is an enlarging, or dilation, which is a ballooning out, which then affects the heart's ability to pump blood adequately. That is the easiest way to think of heart failure. Will the symptoms be different between thick walls and thin walls? That is a good question. I actually don't know off the top of my head. So when I learned heart failure in nursing school, I learned it as right side and left side. They have since changed it to diastolic and systolic, which has to do with how the actual cardiomyopathy exists. So I actually don't know off the top of my head the major differences between the two or what causes them. I haven't relearned that. I probably should. Any questions before we move on? Pink Lemon, thanks for the follow. Welcome to the Floppy Flock. Welcome in. Does this make sense? Are you guys comprehending? Comprende! What's this? What's a myocardial infarction? The big word for a very common thing that was referenced. It's a heart attack! A myocardial infarction is a heart attack. So a lot of people have asked me what's the difference between heart failure and a heart attack. Well, guess what? You gonna learn! Today, you gonna learn. So, myocardial infarction. Here's my picture. So what happens in a heart attack, right? You have an interruption of blood flow to the coronary arteries, which supply blood flow to the muscle, the heart muscle, right? So the muscle in your heart requires blood. Just like every other muscle and every other organ and every other structure in your body, your heart needs blood, right? Without blood, it cannot get the resources it needs to function. A heart attack or a myocardial infarction is an interruption or a blockage of that blood supply to an area of the heart that then causes damage to the heart muscle to the point where it affects contraction and the ability of the heart to pump. That is it in its simplest terms. It is a interruption of blood flow to the heart. I just got to school and now I'm back in school. Good, learn. You're primed for learning then. You've been learning all day, which means you're all warmed up to learn some more. Oh god, that's huge. It's a little blurry now, but that's okay. So, let's look at the normal heart, right? So these are your coronary arteries, right? That branch off your aorta. They kind of surround the heart like a structure, like a wire structure, right? Supplying blood to all of the muscles of the heart so that way it can continue to pump and keep you alive. Nice, normal, healthy artery, blood flows through, no issues. If you get a blood clot in there, you can have an interruption of the blood supply to part of the muscle, which will then cause the muscle to atrophy and die, right? This is a heart attack. Very common for people who have really high cholesterol diets, right? Or who don't take care of themselves or who have, who don't exercise regularly. You get what we call atherosclerotic plaques, where you get these plaques that build up in these coronary arteries. These arteries are really, really tiny, right? These are small arteries, so they can get clogged very quickly. And if you just get unlucky enough to have a small blood clot float in there and get jammed, well, congratulations, now you're having a heart attack, okay? Swimmer terms, heart attack can cause cardiac calcification, heart tissue returning to bone. I don't know if that's true. I've never heard of that. It just causes it to die. Will you talk about defibrillators? Not this stream, no. So, the blood flow has been interrupted to the heart, right? The heart muscle begins to die, and you start to get symptoms of a heart attack, right? Chest pain. Sometimes they'll get pain in the neck, the back, the arm, right? It's going to feel like a tight squeezing pressure, right? Usually people say, oh, it feels like an elephant sitting on my chest, right? It's going to feel like a squeezing tightness in the chest is what people are going to refer to it as. Sometimes you'll have pain referring down to the left arm. Sometimes you'll have back pain. Sometimes the pain will be up in the neck. It just depends on how your body decides to present the symptoms, right? You're going to have shortness of breath, right? You're going to be cool and clammy. And maybe even sweaty, right? They might lose consciousness on you, right? It depends on how severe it is. Really, that's about it. I mean, there are other symptoms too. Some people come in with like abdominal pain and they end up having a heart attack. It can be really vague sometimes, especially in females. Females tend to have more vague heart attack symptoms. They'll have like lower back pain or like abdominal pain, or like a heartburn feeling, like a burning pressure or pain instead of a squeezing pain. It's a little bit weird. We don't really know why. Females tend to have more varied symptoms when it comes to myocardial infarctions than males do. We don't really have a reason to understand why. Short Keith, thanks for the follow. Welcome to Flobby Flock. Welcome in. There are two classifications of heart attacks, and I've talked about these before in the past. You have your non-STEMI, and you have your STEMI. The main difference between these two is that a non-STEMI is the better of the two to have. If you're going to have one, you might as well have a non-STEMI. A STEMI, or an ST elevated myocardial infarction, essentially this means that you're having a heart attack bad enough to cause an altering of the electrical pathways of your heart, right? So as this heart muscle dies, right, and electrical impulses take longer to travel through that heart muscle, it causes changes in your EKG that we can recognize as a heart attack. If you've done enough damage to cause changes to your EKG, you're in some deep shit. We call that a STEMI, right? You can have a heart attack or an interruption of blood flow that does not cause enough damage to the heart muscle to affect your electrical conduction. We call that a non-STEMI, or non-ST elevation myocardial infarction, right? STEMIs are worse. STEMIs go to cath lab. Non-STEMIs usually get stress tests and stuff. What do you think of Cyberpunk 2077? Not super excited about it. I haven't really given it much thought. I might pick it up in a couple months when it's actually physically playable and not super buggy. It doesn't help either. Heart attack symptoms for women will get dismissed more frequently as well. I think part of the reason why is just because sometimes they're more vague, right? Now, I can tell you in the emergency department, anybody who comes in with abdominal pain gets an EKG and cardiac enzymes drawn. So we definitely check. But I can't say we've ever not caught a heart attack if a patient's having a heart attack. So, what do we do if you're having a heart attack? Bad Dragon, thanks for the follow. Welcome, Flobby Flock. Welcome in. Mastermind, I see you.
Sorry I'm late, but happy 5 months of learning from Best Collie, Heart.
Mastermind coming with the tier 1 sub for 5 freaking months. I'm sorry, the Twitch Prime sub for 5 freaking months. Mastermind, you're covered under collar care from the floss to the beans. I got you covered. Enjoy your blue sheep now. Thanks for the 5 months. I'm glad that you've been here for so long. I'm glad you like learning. Multi! What's up, Multi? All right, so your patient's having a heart attack. And for all intents and purposes, we'll say our patient's having a STEMI. All right, so they're having a bad enough heart attack that it's altering the electrical pathways of their heart, which eventually will lead to cardiac arrest. By the way, you've been a really bad dragon. Well, it's time to shape it up and get yourself together and get your life together and be a good dragon. You can be a good boy, like me. Because let me tell you, there's nothing better than being a good boy. Yes, being a good boy is the best thing. Yes, it is. Okay, I got that out of my system. Feel better now. Okay. So let's say you're having a STEMI, right? Well, assuming that you don't go into cardiac arrest before we can get you up there, we're going to take you up to cath lab. Who knows somebody who's got a stent in their heart?
In Twitch jail you learn quickly.
Broster, yes, you learn quickly because you gotta do what you gotta do to survive in Twitch jail. I've been there. It's scary, horrible, cold, lonely place. You gotta do what you gotta do to survive. Thanks for the 100 bits, Broster. I'm still waking up. Wake up! Wake up! Get coffee, wake up! Your father has a stent? I know people, there are patients who come in with like 7 of these things. So if you're having a bad enough heart attack that it causes changes in your EKG, we're going to send you to cath lab. What's cath lab going to do? Well, cath lab is going to do what we call PCI, percutaneous coronary intervention, or PCI for short. They are going to access your femoral artery and stick a catheter all the way up your groin, past your, through your abdominal aorta, through your aortic arch, and up to your coronary arteries, right? They're going to do this with a big needle that they stick into your leg and then feed a catheter all the way up. What they are going to do then is they are going to find the blockage in your heart, and they are going to put a stent in there. A stent is this tiny little wire structure here that we use to open up that coronary artery. So if you can see here, you got your blocked artery, right? The catheter gets slid up in between the blockage there, okay? The balloon on the end of the catheter is inflated. Around that balloon is a wire structure known as a stent. That stent is then left in place, the balloon is deflated and retracted and pulled out, and now you have a stent or a wire structure holding open that artery to continue blood flow to that area of the heart. This is what we call a stent, or percutaneous coronary intervention, PCI. This is a huge deal. We have saved a lot of lives with this technology. A lot. Consider, though, much less invasive than opening the chest, which we will talk about in a second. Sneaks in with a grilled cheese. A shadow fluffy boy. God damn it. Bring it up. Come on. Give it to me. You know the rules. No eating class. Come on. Bring it. In my hand. Right here. Right here. Give it to me. You know you can't eat in class. You know this. It's a fairly routine procedure now. Yeah, it happens. We do it regularly. We do it regularly. Like 17 stents, and I don't know how many heart attacks. He just recovered from COVID a few months ago. I'm surprised that he recovered. Stop eating in my class, god damn it. You're all gonna be gassy. You guys are all gonna be sitting there, right? After class. You're gonna be sitting around, right? Suddenly you're gonna get that rumbling in the tummy, and you know what's gonna happen. That's gonna be all of you nasty asses from eating in my class. We just vibe for a second. All right, that was our scheduled vibe break. That was our vibe break. You guys all vibed out now? Mika, hey! What's up? Do I like Scooby snacks? Is that a euphemism for something? Now, say we did a routine heart cath and took a look at your artery. So we can do something I forgot to mention. We can do what's called a coronary angiograph, where we actually inject dye. We do the same procedure. We go in through the artery, right? Get up to the coronary arteries, and we'll actually inject a radioactive or a dye, a contrast dye, into your arteries to light them up to see where the blockage is. Sometimes they'll do that and they'll notice a blockage that needs to be bypassed. Who knows anybody who's had a coronary artery bypass graft or a cabbage? Coronary artery bypass graft. Who knows somebody who's had a heart bypass before? You've never seen Scooby-Doo? I've seen Scooby-Doo. I know what Scooby-Doo is. I just thought, you know, I feel like Scooby snacks sometimes are a euphemism for, like, other things. I've had cabbage, but not that kind. Cardiopulmonary thrombosis. Cabbage times 4 for your uncle. I used to work on, this used to be like my bread and butter. When I used to work on cardiothoracic step down, we used to do cabbages. We used to deal with patients with cabbages all the time. So what is a cabbage? Coronary artery, so heart artery bypass graft. So we're just going to bypass the blockage. That easy, it's just plumbing. We're just going to reroute the plumbing. So what they'll do is you'll go into surgery. They are going to take a vein from your leg. Generally, it's the greater saphenous vein. They are then going to use that vein, attach it to your aorta, and attach it to the part of the heart just below the blockage to bypass that blockage. So it's like it's not even there. This is what's known as a coronary artery bypass graft. Very simple idea very complicated to do. Very hard to do. Some patients can have multiple of these. I think the highest I've seen was a cabbage times like 5 or 6. Most people get like 1 or 2. Some people get 3 or 4. If you're really sick, you can get more than that. I've sat in on a few of these. It is the coolest damn thing in the world to watch a surgeon work on a beating heart in an open chest cavity. It is super, super, super cool. The hospital sent a tracer like that through my late grandpa to check his pancreatic cancer. That took 2 hours to go through to his liver being mostly dead. Oh, it was probably like a, so they put like a some kind of radiolucent or something to show up on the scans. Contrast dye. It's called Omnipaque is the one we use now. I've worked in the ER as a scribe and I never actually understood what cabbage was. That's awesome. Yeah, straightforward. You just bypass it. You got a blockage here, I'll just bypass it. Right? Takes about 6 to 7 hours depending on the surgeon, but yeah, we'll just bypass it. You scribed in the ER too? I love our scribes. I like the scribes. They're fun. You guys are like, you just get to hang out with us and you get all of our cynicism and you just kind of like get to chill. And it's fun. Are you a malignant tumor? Because I can't seem to get you out of my head. Okay, that's okay. Decent enough. That's about it. Any questions about heart attacks before we move on? It's just a tumor. It's not a tumor. Get to the chopper. I still don't understand what is the cause of a total eclipse of the heart? What is the rest of that song? I need you more than ever. You talk about that song? I guess needing somebody causes a total eclipse of the heart, right? Bad puppy cynicism, not nice. You try working in the emergency department during a global pandemic and not become cynical of everybody. Screw people! Everybody sucks, you're all plague rats! Nasty, nasty plague rats who don't wear your masks! Everybody sucks! Raptor Buddy, thanks for the follow. Welcome to the Floppy Flock. Welcome in. Oh, God. Do you guys understand heart attacks? At least better now than you did before? Because we're going to move on. We're almost done, guys. We got a couple more. Two more common ones, and then we're going to talk about 3 fun ones. It just makes me worked up because the doctor said I was morbidly obese. So, I mean, it depends. Like, there are scales and, you know, like your BMI and whatnot, but I don't know. Do what your doctor tells you to do. I'll just say that. Do what your doctor tells you to do. Mika, you don't understand? What don't you understand? Evan, you agree with cabbage being so cool to see being worked on? Cabbages are awesome. They're really, really neat. You weren't here, so you know nothing? Well, then you can start learning now. So, heart valve disease. If you remember, in our anatomy lecture about the heart, we talked about the 4 heart valves, right? You have your tricuspid valve, your pulmonary valve, your bicuspid valve, and your aortic valve. And these valves separate the chambers of the heart, and they also separate the heart from pulmonary and systemic circulation, right? They're what help maintain pressure that helps your heart pump, right? Without these valves, blood would just flow around freely and have nowhere, it wouldn't really do anything, right? These valves are required to prevent backflow through the heart and to maintain pressure. Matt Frostpaws, thanks for the follow. Welcome to Floppy Flock. Welcome in. What can happen to these heart valves, though, is they can become diseased or damaged. So, a normal heart valve, right, is going to open big and wide, and it's going to shut tight and closed, right? It should open up big and wide to let blood out, and then it should shut closed, so nothing can get back through. Well, sometimes, either through infection or poor diet, or medications, or just old age, you can develop calcifications on these valves that prevent them from opening and closing properly. Open wide like the cat mean? I don't know if that went through or not. This is what we call valve disease, or valve stenosis, right? Stenosing of the valve, a failure of the valve to close, right? I agree with valve disease. I used to make good games, not anymore. Nice. A nice impression, cat pop. Oh god, I hit my headset. Okay, so valve disease. So if your valve isn't working properly, there's two things that can happen. A, if it's not opening all the way, you're going to get a shunting or a stenosing of the blood, right? You guys ever heard of heart murmurs before? Like a heart murmur? I love when I go to do an EKG on someone and it's like, oh, I have a heart murmur. Like, yeah, I'm not going to see that on the EKG because it has nothing to do with EKGs. See if I can find the sound of it. Okay, perfect. I'll pause the music for a second. So we've talked about heart sounds before in the past, right? S1, S2. So let's see what this sounds like here.
After the ventricles have heart sound of the AV, the first makes a lub after the ventricle and systole,
can I get the actual sound?
which of course affects cycle. Their changes.
Oh, that video sucks. I just want to hear. Here we go. Let's see if this works. Do you hear how it drags? So you know how normally your heart it goes like boom, 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 boom. Listen how it kind of drags, right? It kind of like woof, woof. It takes a little bit longer. Listen. Do you hear that drag? That is a heart murmur, right? Let's see. There's a couple on here. Mitral stenosis. Let's see what this one sounds like. You hear the drag? Let's see. This is a different one. Holosystolic. Well, that one's easy. So you can hear the lub dub and the underlying lub dub. You hear that drag though. That is a heart murmur. So what's happening with a heart murmur? Let's talk about that. Sounds like dragging a bag and not a beat. I always think of it like a drag, like an extension, like a right? What's happening is when this valve, especially like when it's stenosed like this, right? When it's not closed all the way, or if it doesn't open all the way, you get blood that's still moving in between heartbeats, right? And that can kind of sound like a whooshing or a dragging noise, right? Because remember, your valve should open and snap shut. Lub dub, right? They should snap shut and no more blood flow should be moving, right? But when they're not opening all the way or they're not closing all the way, if it doesn't open all the way, you get a stenosing of the blood or a tightening. It goes through a narrower tube, right? So you get a higher pressure going through there, which causes a different noise. Or if it doesn't close all the way, you're still getting blood flowing in between heartbeats. Heart murmurs are caused by valves. If you have an abnormal heart valve, it will cause a heart murmur. Wooden Toaster, thanks for the follow, Bucks and Flobby Flock. Welcome in. So when people are like, oh, I have a heart murmur, can you see that on the EKG? I'm like, no, I can't. You don't know what a heart murmur is. So if anyone ever tells you they have a heart murmur, it's a sound. It is a sound due to the shunting or stenosing of blood through a heart valve. That is what a heart murmur is. Furry Dr. Hot, I'm not a doctor, I'm a nurse. God damn it. Thank you, though. So how do we fix this? Or rather, what are the causes of this? So some of the causes of this are going to be old age, infection. Certain infections will cause a calcification or like vegetation to grow on these valves, right? Other heart disease, which put pressure on these valves, such as like congestive heart failure, other things like high blood pressure. These are all things that can affect this, right? Some of the symptoms you're going to get with this, obviously, you're going to get chest pain. Shortness of breath is a big one. And what the other big one is going to be fatigue as well. So when you have a heart valve, specifically your aortic valve as well, this big valve that separates your heart from systemic circulation, if this one doesn't work properly, say it doesn't open all the way, right? Or it doesn't close all the way, you get minimal, or you get less circulatory blood than you would if it worked properly. So a lot of patients with heart valve issues, especially aortic heart valve issues, these are their two main symptoms. They get really short of breath with exertion, and they get really tired very quickly, because any excess stress on the heart, your heart can't keep up if it can't actually pump the blood out of the valve that's messed up, right? It can beat as hard as it wants, but it's not going to get the blood out if the exit is blocked, right? Or if it's not working properly. They might also have some palpitations, other things like that. All right. Treatment for this. Surgery. We actually have a surgery now that's relatively new. I used to work with a surgeon who was one of the, I was told he was the first surgeon to do this procedure in America. This procedure's been going on in Europe for a little bit. He went over and learned the craft, brought it over to America, and worked at Emory University Hospital down in Atlanta. It's what we call a TAVR. Transcatheter aortic valve replacement. So, just like we did with our percutaneous coronary intervention, we are going to feed a catheter up through the aorta and over to the aortic valve. But this time, instead of going to the coronary arteries, what they're going to do is they're going to deploy an artificial heart valve over top of your old heart valve. So they take their little balloon and their catheter, feed it right into the heart valve here, and then deploy an artificial heart valve that then takes the place of your old valve. This is what we call a TAVR. This procedure is amazing, because the other way of doing this is you do a sternotomy and you open up the heart, or you open up the chest and you do it open, right? This can be done in the cath lab with minimal invasion or minimally invasive, right? And these patients can go home in a day or two after having a brand new heart valve inserted into your heart. Just remove the heart. No, then you die. I find palpitations weird. I've been told your conscious mind can't affect your heart, but then I've also been told that high stress can cause them too. It can. Once again, stress just increases your fight or flight and increases adrenaline and whatnot, which causes your heart to beat quicker, which can cause palpitations. Minimally invasive procedures, we love to see it. You love to see it, chat. You love to see the minimally invasive procedures. The valve disease. It's a failure of the valves to either open all the way or shut all the way, causing shunting of the blood through the heart, which can cause some shortness of breath and fatigue, as well as some chest pain, and can be fixed with surgery. More commonly now, the TAVR procedure, which is a cath lab procedure where they put a catheter in through your groin, up your aorta, and over to the aortic valve, where they can then deploy a new valve over the old one. Now, questions about heart disease or valve disease before we move on. Minimally invasive equals less risky? Typically, yes. Is it technically considered plumbing? Yes. Cardiac surgeons are just very highly qualified and high-paid plumbers. They're also doctors, but they're basically just plumbers. All right, vibe breaks over. Why are they always going through the groin? Larger plumbing? Yes, your femoral artery is there. Look at this. Femoral artery goes up to your abdominal aorta, which goes right up to your heart. Quickest way there. Now, they can do it through the wrist. More recently, in last couple of years, they've started doing, especially like your PCIs, like your heart caths, they've started going in through the radial artery and going up this way. Actually, it would be this way, right? They can do that as well, not for the TAVR. Because this balloon is bigger and the heart valve is bigger, you got to go in through a bigger artery. Thus, you go in through the femoral. Any questions about heart valves before we move on? Who's ever heard of pericardial effusion or cardiac tamponade? Knows what that is. Aren't they always moving upstream if they go through the arteries? They are. That's fun. Can you have a bathroom break? Sure. My favorite mnemonic to remember in order of valves is try before you buy. Yes. Tricuspid before bicuspid. Radium, I'll give you a better one. So when we intubate patients, right? When we have to put a breathing tube in you, we have to give you a sedative and a paralytic. So we sedate you first, and then we paralyze you so we can put a breathing tube in you. Well, the medications that we typically use, we use etomidate, which is a sedative, and then we use succinylcholine, which is a paralytic. So I always remember in my head which one to give first is you got to date before you suck. Etomidate before succinylcholine. You got to date before you suck. The other medication we use is rocuronium as well as a paralytic. So etomidate and rocuronium. So you got to date before you can rock the bed. That's the other one that I like to use as well. Wooden toaster, what are you talking about? Chill, man. Chill. No one wants to hear about your testicles. Nobody wants to hear about them. Chill. Date before you suck. Etomidate before succinylcholine. You never want to paralyze someone without sedating them. They'll be terrified. You ever get hot and flushed when trying to intubate someone because of those mnemonics? No. No. Alright, who's ever heard of pericardial effusion or cardiac tamponade? Who knows what these are? I can play the trombone. That's not the same. Pericardial effusion. Tar Husky, thanks for the follow. Welcome to Floppy Flock. Welcome in. All right, buddy. Bye, Wooden Toaster. It was nice. Pericardial effusion. Remember when we talked about the heart and I told you that the heart sits in what we call the pericardium, which is a little fibrous sac that holds the heart in place and also lubricates it? Well, sometimes you can get fluid in there. Sometimes you can get fluid in there. Fluid in the pericardium puts pressure on the heart. This is what's known as pericardial effusion, right? So if you can see in the pictures, here's your heart, here's the pericardium, this little fibrous sac that secures the heart to the chest and also provides lubrication for the heart so it can beat without causing friction. All right. Now, pericardial effusion is when you start to get swelling or inflammation of the pericardium that causes fluid to build up in that sac. All right. This can be caused by a couple of things. Primarily and more commonly, infection will cause this. Certain viruses and certain types of infection will cause pericardial effusion.
When it's time to party, we will party hard.
Dude, Zeke Fox coming with a party of 8. Zeke Fox, thanks for the raid. Thanks for sharing your community with mine, and thanks for blasting my ears full of wonderful Andrew WK. Smells like a fox raid. Yeah, it does smell kind of stinky, doesn't it? It smells like fox. Ugh. Ugh. Zeke Fox, what were you playing? What were you doing? Tetris. Did you beat it? Are you like God level Tetris player? Welcome in, guys. Am I late for the lesson? Not quite. We got a couple more to talk about. Tetris. Yes. So,
Shotspot.
pericardial infusion caused by inflammation of the pericardium that causes a fluid buildup around the heart, right? So the fluid buildup is not actually in the heart, it's in the sac that holds the heart, right? Well, that fluid then puts pressure on the heart because now you have pressure coming in from the fluid pressing on the heart, which can affect the way that the heart beats, okay? Like I said, primary source for this is infection. Viruses such as the cytomegalovirus, the Coxsackie virus, the HIV, tuberculosis can cause this, right? Anything that you can get that can cause infection in the pericardium can lead to pericardial effusion. Also, trauma. If you have a traumatic event, say you get stabbed, right? And now you have blood leaking out of the heart and into the pericardium. That can cause pericardial effusion because then that sac is going to fill up with blood from the heart and eventually start to put pressure on the heart. Now, eventually it will reach a point where the pressure inside the pericardium equals the pressure of the heart, and it actually starts to affect the way that the heart beats. This is known as cardiac tamponade. So pericardial effusion and cardiac tamponade are different levels of the same thing, which is fluid buildup in the pericardium. Pericardial effusion is the first one. If it gets worse, it turns into what we call cardiac tamponade, where it actually starts to compress and prevent the heart from expanding and beating, okay? This is a medical emergency. You will die of cardiac tamponade. This is very common in traumas. You can get cardiac tamponade, but once again, infection can cause this as well. All right, what are the symptoms of pericardial effusion or cardiac tamponade? Cardiac tamponade. Rosillo! God damn it! Yeah, you're making me naked. Everybody wants to see me. Everybody wants Cinder to be naked. Nobody ever says, Cinder, you should put your clothes on. You're naked. No, everyone's like, Cinder, get naked. Get naked for us. Show us your chest. We want to see what's underneath the bandana. In the middle of a lesson, Rosillo. God. How about fungal endocarditis? Heard of a person getting it from a dirty needle? You can get infectious endocarditis from IV drug use. Happens all the time. You're far from naked? Don't look at me! Oh, come on. Give me my other hand. Don't look at me. I'm naked. Don't look. Don't look. Stop looking. Stop it. Stop it. I'm naked. No. Stop. Okay, you can look now. Still like Cinder 1.0 with chest flip. I still have them. I can still use them. I like this model way more because it's expressive. I like being able to do expressions and things to make my character more animated, more exciting, more possibilities. So what do we do? Just drain the fluid? Yeah. Actually, yeah. So some of the symptoms, right? Obviously, chest pain. Right? Shortness of breath. All right. Palpitations. Okay. One very important thing, or one interesting thing about this. Beck's triad. Beck's triad is a constellation of symptoms that is consistent with cardiac tamponade. There are three things that you will see when you have a patient who is in cardiac tamponade. A lowering of their blood pressure. They'll have muffled heart sounds. And they'll have what we call jugular vein distension, or JVD. So why do these happen? So, if the pericardium is full of fluid, right, it is going to press on the heart, which means the heart is not going to be able to move as much blood, which means your blood pressure is going to drop. Less volume equals less pressure, right? Muffled heart sounds. you now have to listen to heart sounds through a sac of fluid. They're going to sound distant and muffled because the fluid in the pericardium is going to dampen that sound. Jugular vein distension. Your jugular vein is the giant vein in your neck, right? You have two of them, one on each side, that bring blood from your brain back down to your heart. As the heart begins to get squeezed, less blood is going to be able to enter, and one of the first places it's going to back up in is your jugular veins. So your jugular veins are going to like be popping out of your neck. They are going to be bulging, what we call jugular vein distension, or JVD. This is known as Beck's triad. These symptoms are consistent with cardiac tamponade. I actually wrote a paper about this in nursing school, Beck's triad. Who did your avatar? The original avatar is by Gagash, who is on, he makes VR models. And then Jokin reskinned it and recolored it to my character. And then Flyzik turned it into a VRM model and added the bandana so I could use it with VC Face. So 3 people have worked on this. I remember that model you got off booth at a Japanese modeler. I opened my friend is bisexual yesterday. They were understanding. I'm very happy. Well, congratulations. It's not an easy thing to do. Hopefully they'll continue to accept you for who you are. Still teaching? Yes, Krakow. We are still teaching. How do we treat cardiac tamponade? Well, we take a needle and we shove it in your chest and we remove the fluid. Does this not go any bigger? We just take a big old needle. We do what's called a pericardial centesis. Anytime you hear anything that's like centesis, right? So you have like your paracentesis, thoracentesis, pericardial centesis. It is a removal of fluid, right? So we're going to stick a needle in here and drain it out. And then you go to surgery to fix the underlying issue. Or you get antibiotics to treat the infection. All right, guys. Almost done. I got 3 more to talk about. These ones are fun. These are like really interesting, rare heart diseases that I think are really fascinating. And then we'll get on to Superliminal, because it's already 4:30. Holy freaking crap. Does Tinder give us more of the you're not following your heart, that's all in your brain thing again? I did. God, that's horrible. Hold on, let me do that again. Who's ever heard of tetralogy of Fallot? Anybody? So these are, now that we're done with most of the common ones, these are ones that I just think are interesting that I want to talk about because I think they're kind of neat. Who's ever heard of tetralogy of Fallot? Anybody? Has anybody ever heard of this? If you're not in medicine or you don't have it yourself or know someone who has this, I highly doubt you know what tetralogy of Fallot is because it's kind of a rare thing that doesn't get much conversation outside of medical circles. Neezy, thanks for the follow. Welcome to Flobby Flock. Welcome in. Tetralogy Fallot is a birth defect. So the next couple that we're going to talk about, the next 2 we're going to talk about are birth defects. Tetralogy of Fallot is a constellation of problems with the heart, 4 of them in particular, which is why it's a tetralogy, right? That can occur with the heart. This is typically found at birth, sometimes even prenatally, or when they're in the intrauterus before your baby's even born. Tetralogy of Fallot. The 4 hallmark signs. You have an overarching aorta, so the aorta extends out too far. It's long and narrow. You have pulmonary stenosis, which means you have a stenosing of the pulmonary vein into the lungs. Okay? You have a ventricular septal defect, which means that the ventricles are not separated. You have a defect in the septum, so you have venous blood and arterial blood mixing within the ventricles, and you have right ventricular hypertrophy. This is what we call tetralogy of Fallot. Essentially what it is a birth defect that causes the heart to not be able to separate the two ventricles, causes an enlarging of the right heart due to the fact that the pulmonary valve is stenosed because you have an overarching aorta. One letter away from being 4 Fallout games. I know. I have to think about that every time. This is a rare birth defect that can happen, and like I said, it's usually caught either pre-birth or shortly thereafter. We don't really know why this happens, we just know that it happens in some babies every once in a while. You get this. What are the signs? Your baby's going to be blue or cyanotic, right? They're going to have shortness of breath or difficulty breathing because they're not getting a lot of blood to the lungs, and they're not getting a lot of blood flow back, right? And they're also going to have what we call failure to thrive. Which just means that they're not getting bigger and they're not doing well. How do we fix this? Surgery. You get a surgical fix for this, they go in and fix everything, and then you hopefully never have to deal with it again the rest of your life. Wait, what happened? How do you support gays? Just wondering. I'm not judging. I am gay. I am gay. How do I support it? I don't know. I'm part of the group. Like, I don't really have much to talk about with this one other than I just think it's fascinating. I think it's fun to say tetralogy of Fallot. I guess Dr. Fallot is the one who discovered this, some French doctor. Oh god, this one's gonna suck to write. Does anybody know what transposition of the great arteries is? Which is probably like one of the coolest names for a heart disease that I think I can think of. We need tetralogy of cinder necks. Has anybody ever heard this? Transposition of the great arteries. Cool name for a very interesting thing. Your aorta and your pulmonary artery are switched. Birth defect. So instead of your aorta coming out of your your left ventricle, it comes out of your right. Instead of your pulmonary artery coming out of your right ventricle, it comes out of your left. They're just switched. So you see your normal heart here, right? How they cross over? In transposition of the great arteries, they're just switched. This is just so cool to me that this can happen. Like, I don't know why I think of this. I'm like, this is so freaking neat. The birth defect, usually once again, caught in the womb or shortly thereafter birth. Very similar symptoms to what's going to happen with tetralogy of Fallot. You're going to have cyanosis, failure to thrive, shortness of breath, right? And treatment for this is immediate surgery. They just go in and fix the plumbing. Does blood actually fully circulate? Kinda, yeah. Not really, though. Not well. This is not. You don't live long with this. You got to fix it pretty quickly. The heart's in the wrong place. Surgery. No. I don't know. I don't really have much to talk about this one. I just think it's pretty cool. I still think it's blown away that after my dad's heart attack, his heart was able to reroute blood flow to keep 90% functionality, and the cardiologist said his longevity is unlikely to be impacted. Maybe sometimes if you don't have a bad enough heart attack, or if it's in the right spot, you can, I mean, body compensates pretty well. Is he gonna like, did they do a bypass on him? Okay. Last one. Anybody know this one? Riley the Fox, hey! Octopus Char, you're correct. This is better known as something else. No bypass because he stayed in bed and refused to go to the hospital for 4 days. Arterioscope revealed open passages and nose dysfunction despite the closed section. Interesting. Takotsubo's cardiomyopathy. Better known as broken heart syndrome. So, earlier today we talked about cardiomyopathy, specifically dilated cardiomyopathy, right? Where the ventricle actually balloons out, right? There is something known as Takotsubo's cardiomyopathy, which is a dilated cardiomyopathy that occurs temporarily, typically temporarily, after high emotionally and physically stressful situations. The common thing that people reference is the loss of a loved one or like a divorce, right? That's why it's known as broken heart syndrome. What happens is the heart balloons out in a way that it looks like an octopus pot. Thus the name Takotsubo cardiomyopathy. I guess it isn't technically anybody's specific name, it's just Takotsubo. Which is the Japanese octopus trap, also known as a Takotsubo. So, under periods of severe emotional stress, your heart can actually dilate out and cause Takotsubo cardiomyopathy, known as broken heart syndrome. We had a patient in the emergency department within the last couple weeks who had this. And we didn't know why. They didn't have any stressful emotional situations going on. They just developed Takotsubo's cardiomyopathy. But if you look at it on a angiogram, you can see how it balloons out. Protogen Beast, thanks for the follow. Welcome to Fobby Flock. Welcome in. Ambi Lambert, thanks for the follow. Welcome to Fobby Flock. Welcome in, guys. You can really die from a breakup. You can. You can get broken heart syndrome. Why does it balloon out after getting a broken heart? We don't really know. It has something to do with the way that the stress hormones affect the heart muscle. They think it causes it to be like stretched out. It causes something to alter the heart muscle, but we don't really know. We don't know why it happens. We just know that it does. Once again, I don't really know a whole lot about this. I just think it's really fascinating. Is there a way to recover from a broken heart syndrome? Yeah, it's usually temporary. Usually this will fix itself. Sometimes patients need to be managed with it, but typically it's temporary and it fixes itself. Possible to get a Charlie horse in your heart? Like a cramp? I don't know. Probably not. Since you're jamming to the tunes and doing much ear flop? That's it. That's the end of my lecture. The end of my notes. Took a lot of notes on this one because I had a lot to talk about. Twitch stream, more like learn something stream. That's what we do here. We learn. And then we play puzzle games. Volkwolf, thanks for the follow. Welcome to Fobby Flock. Look at how much we talked about today. Holy crap. Ah, that was a long one. Like an hour and a half it took me to do all that. Did the pictures help? I like using, I think sometimes the hardest part is just finding pictures that I want to use to actually portray what I'm talking about. I still think you should quiz us. No, I'm not gonna quiz you.
I found these in my desk. You can have them though. Thank you for the lesson.
Cyber Panda, thanks for the 100 bits. Thanks for the extra bits you found in your desk. I appreciate it. Thanks for making Tux dance. Look at that werewolf go. I wasn't paying attention in the first because I was working on homework due to class. I got the last half. What did you guys learn today that you didn't know previously? I want to know. What did you learn today that you think was fascinating or interesting, or that you said, man, I didn't know that, or man, that's really cool, and I've never thought about it like that before? You're such a nerd, but it's appreciated. Oh, I just like the body. I think it's fascinating. If we're going to be living in these meat machines, we might as well understand how they work, right? We got to the heart of the situation. The lecture was good. Had a beat to it. Well, nice. Thank you. Octo heart, everything. Broken heart disease, how high blood pressure works and affects the heart. If you tried quizzing, you have to make notes and figure out how they're... I'm never going to quiz you guys. I do not like teaching for the sake of passing a test. You should not learn to pass a test. I'm going to finish that thought in a second.
Oh no. I'm way too late.
Shadow Protege, thanks for the 2 months. Shadow Protege coming with a tier 1 sub for 2 freaking months. Protege, you're covered under collar care. From the circuits to the wires, I got you covered. It's okay, you're late. The VOD will be posted online in a little bit. That a cabbage takes a vein from the leg to bypass the blood clot by attaching straight to the aorta to the heart. Learning about TAVR and cabbage is probably the most interesting thing. If you're really interested, go look up videos of cabbages. You can find videos of them online if you can stomach it. It's pretty freaking neat. I knew about the broken heart thing and the open chamber thing. Rest was pretty much new. What a heart murmur actually is. I heard about it but never knew how it sounds. The test isn't for us to pass. So, okay, so testing. So testing. I don't like teaching towards a test because I do not like taking tests myself. You should not learn to take a test. You should learn because you want to learn and because it's interesting stuff to learn and it furthers your knowledge of how your body works, right? I will never test you guys. Never. That is not my intention. My intention is to educate you guys on your body, how it works, what happens with it when things go wrong, and help you make informed decisions about your health and your body. You will never be tested in my class. Everybody gets an A. Except for Tux. He gets an F. For find me after class, Tux. We're gonna talk. The test isn't for us to pass. It's for you to evaluate your attention and identify segments that might have fallen short with your audience. But if it falls short, then you tell me. If you don't understand something, tell me. I'm not going to test to look for retention or understanding. There's no need. You should just learn what you can, and if you don't understand it, then do further, look it up yourself. Or I can help explain it.
Hi Cinder. Your classroom has replaced podcasts in my little group's trip across the Nevada wilderness. More fodder for the flock.
Aw, Fletcher
Cinder
K, thanks
7
for the
love.
follow. Welcome to... Oh my god, thanks for the tier 1 sub for 5 freaking months, Fletcher. That's awesome. Do you just play it on, like, in the background? Am I plugged into an aux cable right now? Hi, everybody in Fletcher's car. Hi. Thanks for the 5 months, Fletcher. You're covered under collar care. From the flops to the beans, I got you covered. Thank you. Also, Zeke Fox, I saw you up there. Hold on. Zeke Fox with the 1 bit. When I was playing Katamari Damacy. Katamari Damacy. I like the songs from that game. I rounded up some sheep, got them all. So when I was given my Kali learner's permit, I'm totally excited that I passed my introductory course. That's not herding 101. You gotta go to school for that. You can't play games and learn herding 101. Also, you gotta nip their ankles. You can't just roll them up. Hello.
Corgo 1, 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 Corgo 1.
Oh, it's done. Nuo with the 60 bits. Thanks, Nuo. Thanks for the Corgo 1, Corgo 1s, Corgo 1s. We need Kali notes on your Discord channel. No pictures yet. I'm just gonna upload the VODs and you can look at it there because I don't actually save my notes because they're so horribly written. Would you ever do a lecture on the cross relation in the brain, like synesthesia and other cross senses? I don't know enough about that to lecture about it. Very fascinated by today's lesson. My late grandfather had heart problems, and now I understand a little more. Good. Got you blasting on speakers? I don't know what that was. I just wanted to make as much noise as possible.
Thanks for the lesson, teach. Cinder Pet.
Primary Split, thanks for the 100 bits. Thanks for making Tux dance. Look at that werewolf go. Quality USDA Prime werewolf. Bandy knows more about brain stuff. He does. I'm not very good at the brain. I don't have a very good brain. I'm not very good at the brain. It's a dumb dog. Dumb, stupid dog. All right, Superliminal time. Hello!
The last of my bits you have earned well over this fox's 2 bits.
Aw. Noel coming with the 35 bits, dude. Noel, thank you. Look at that werewolf. Quality. Quality werewolf. That's the type of werewolf you go to like a high-end store and you're like, give me your top quality werewolf. And they're like, oh, right this way, sir. And then they show you Tux. And then you're like, that is high quality werewolf. Indeed, high quality werewolf. The time for the murder beans? Yes.
If I redeem 100,000 collie coins, can you just start barking and cussing for 10 minutes straight?
Cerulean, thanks for the 100 bits. I can do it right now. In just a second, I'll do it for you. Hold on. Thanks for the bits. Thanks for making Tux dance. Oh, God. Unbelievable, Doug.
Thanks for giving my friends broken ear syndrome.
Cerulean coming with the 500 bits. Unbelievable. I'm sorry, not Cerulean. God, oh God, hold on. Oh God. Fletcher coming with the 500 bits. Disappointing JD. Fletcher, unbelievable. You want to give 500,000 milligrams of morphine? Unbelievable. Unbelievable. Also, the broken ear syndrome, they'll be okay. They'll survive. Hey, I'll do it again for you. It's Cerulean, I owe you this. Hold on. Bring on, give it, stupid son of a bitch, son of a bitch, that was the most frustrated I could sound without actually just straight up cussing. Okay. They don't feel anything now. Good! Superliminal. Back into Superliminal. Trip! Hi.
Woof 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 hyper cheese 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 hyper cheese.
Oh my god. Trip coming with 100 bits. Woof woof. Hold on. Hyper cheese. Be careful with the cheese. You know what happens when you eat a bunch of cheese, right? You get a little gassy. Thanks for the 100 bits. I appreciate it. Guys, this music is so calm. So calm.
Cinder 7 flop, Cinder 7 flop, Cinder 7 flop, Cinder 7 flop, phase tap Jonas 1 Ojvets gasp, Cinder 7s, Cinder 7
What?
hype, Cinder 7 love pride unicorn lol 3 SSSSSS phase tap I'm just basically spamming lol.
Cerulean, thanks for the 69 bits. Nice. What the hell was that? Alright. Superliminal. Angela, take care. Sleep well. Rest up. The last we slept, we had just woken up from, we're on like 7 a.m. now, I think. We had just woken up from yet another dream, and we're going further into the dream state after finding out the murder beans. And hand trackers, I've been living under a rock? Yes. So it's not a hand tracker. It's a, well, it is. It's a camera right underneath me. It's called Leap Motion. And it uses infrared to track my hands. Cool.
What is this, an XQC stream or something? Well, in that case,
Oh my god, I love that. Oh my god. Oh, I need a minute. It came on so quickly. In that case, oh god, Renshiko, thanks for the 100 bits. That gave me a good laugh. 150 bits, oh god. Oh. I gotta do that again, hold on. Hold on, I gotta play that again.
what is this, an XQC stream or something? Well, in that case,
Hold on. I need to turn on the Phantom. Oh my god. Oh, okay, okay. Yeah, Yamabun, thank you. I appreciate that compliment. Thank you. Oh god. Me and Tux love when that happens. So whenever we're watching whenever we're watching Summit, especially when Summit is streaming Tarkov, I love when Summit 1G streams Tarkov. Tux and I will just put it on the TV and just watch it, right? It's always, people always do like the ooh ah, and then we spam it full of stuff. So really, you gotta do more bits than that. It's gotta be 10 at least. Tux ain't no cheap whore anymore. Oh, so I gotta turn the volume down a little bit on this. At least the music. There we go. Oh hey, we got a new room open now. The relaxation room. I have a feeling we're not going to find any relaxation in there. Text-to-speech copy pastas are always a joy. They are always a joy. Ooh. Hey, how's the game sound, by the way? When I went back and watched the VOD, it was a little bit loud. Beta Pop! God damn it. No, what have we started?
This one's for Tuxa Weber. Cinder 7 flop pours entire bottle of ketchup on hot dogs.
Hey! Hey, you little shit!
Hoo.
Oh, wait, what? It just did hoo. Oh god, I need a second, guys. Hold on. Oh. Oh my god. Oh. Oh, Captain Ugly Cactus, I'm sorry that didn't work. Alright, alright. Alright. Oh god, Fletcher.
Hello front desk. This British guy next door won't stop screaming about LLLLLLLLLLLLL. Pra-ah-ah-ah-fla.
What? What the hell was that? 100, thanks for the 100. Mastermind, thanks for the 100. Guys, I want to play the game. Oh, God.
Shazbot!
Oh, my God, I'm dying. I'm dying. We're in the relaxation room now. Over here. Okay, so I guess we have to go in there. Yeah, nothing like says relaxation like weird cult-like videos followed by subliminal messaging of color bars and calming music. I feel relaxed. Oh God.
Wow, you.
Oh God. Oh, yo, PDX, thanks for the 100 bits. Oh God, you guys are gonna kill me. Hold on, don't do anything. I gotta hear this.
Hello, my name is Dr. Glenn Pierce. This is a notification that you have reappeared on our monitoring system.
Paper pack pop potato chips in the 7th flop.
And discontinue whatever you were doing immediately prior to that.
Oh God. Wait, someone check the general in Discord. What happened? Oh God, the text to speak. Why would you do that? Oh God, it's really a thanks for the 20.
Oh no, I feel one coming.
Okay, guys, thank you. Can we stop? I gotta play the game. I want to play the freaking game. Come on. Talent, thanks for the follow. Welcome to Floppy Flock. Welcome in. I'm sorry, it's such a mess right now. Oh God, Beta. What the hell? Beta Bump, thanks for the 10. Oh God. Okay. Settle, please.
Popcorn, popcorn, weird one meep, weird one meep, woof.
Woof. Trip, thanks for the 10. Alright guys, alright, my jaw hurts from laughing. I can't right now. We just gotta stop. We just gotta stop. I'm trying to play this game. Okay, we're out of the relaxation room now. Woof, question mark? How big can I make them? Pretty big. Oh my God, look how big that soda is. I want it. Uh-oh. No! Is that how we break Cinder Boys? Probably. I'm hard to break. I have a question. Do you see something with Superliminal on YouTube? What do you mean? I'm not gonna pee my pants. I'm not that much of a child. Okay, so I gotta make that bigger. No fire extinguishers allowed. Oh, I feel like I'm small now. Did I make this too big? Excuse you. Where's my soda? Hey! Hold on. Hey, I paid for that! Give me my soda! Cerulean!
And I can emphasize this enough. Ha ah 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 or ooh ah woo.
Ha ah ooh ah ooh ah woo. Thanks for the 20 bits, Cerulean. 22 bits. Alright. I gotta compose myself. What happened to your bandana? Aren't you cold? Well, I don't really have a say in the matter because it was taken off, so. You definitely say pop, but mask it with soda on stream. No, I actually do say soda. I don't say pop. I actually don't say pop. Oh, wait, what? Oh, okay, let's make it bigger then. We're micro now, guys! I don't say pop. Cracker, how are you gonna tell me I definitely say pop when I'm the person who actually controls this brain and the words that come out of it? And you're gonna say, no, you say pop when I'm telling you that I don't say pop. Like, I don't understand how you think you could just do that. You hear the music changing? Huh. Cinder Cinder yes. Haven't heard pop for carbonated beverages since my new Kingston, PA kid. It's a Midwestern thing, I believe. Rye Husky! Hey, Rye!
Hello, my name is Dr. Glenn Pierce.
Oh,
In
God.
addition to
Let's
continuing
test this.
and discontinuing its
What the hell? Bendy, the dance. The cinder, please. Can we get some cinder, please? It's in the chat. Oh, God.
mentioned earlier. Please also disregard any unsettling experiences that you may have recently had. Everything should have now reverted to being soothing and therapeutic. If this is not the case, you may be receiving this message in error.
All right, so we're back in our dreams, I guess. It's not weird, creepy stuff anymore as the lights and murder beans and whatnot flicker. Okay. Yeah, this is still unsettling, even though they said to disregard unsettling things. This is still pretty unsettling. Fletcher.
How much longer will this go on for? At least 123 quadrillion 456 trillion 789 billion 876 million 543,210 times.
Fletcher, thanks for the 100 bits. Tux and I used to make our Alexa do that all the time. Look out. How would you make Alexa do that? You just ask them like some ridiculous math question, like what's you know, pi to the whatever power, and it'll give you some ridiculous like quintillion, septillion number. Cinder's OnlyFans, yes! It's where I post videos of me naked like this. Wait, I can pick this up? Oh god!
Help, 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 help inverted exclamation mark.
Inverted expl. Oh my god. Circle, thanks for the 50. Oh my god. Wait, I missed this. I need to pull you. What's that neat looking locker room? Hey, can you imagine what the showers are up there? Wait, what the hell? This is like some Inception stuff. Guys, don't look, I'm in the shower. TOS, TOS, no, Twitch jail.
Hello, my name is Dr. Glenn Pierce, and I'd like to read you my favorite inspirational
Reminds me of
quote
Manifold
by
Garden.
me. The worst thing you can do is focus on negativity. It won't spare you from the cage of death, the pain of disease, the cruelty
wow.
of time, the cold shell of human nature, or the eventual loss of everything you've ever held dear. Whatever you do, don't focus on that.
Thanks. I guess I won't focus on my inevitable doom. You hear that? You need an OnlyFans just standing in front of a fan. I'm not gonna make an OnlyFans. I'm not gonna do that. Grim the Fox, thanks for the follow. Welcome to Fobby Flock. Welcome in. Can I get up there? I can. Yes, give me. Let me in. Let me in. Let me in. You serious? Oh, that should let me in, right? Yes, okay. No fire extinguishers for you. Then he's getting really hot in a room and doesn't know what to do. He gets fan horny. Crackout, what are you talking about? You need to relax. You need to relax. Whoa, what? I make this bigger? I just kind of like float down. Ah! Ah, run! Oh god, my voice. I'm so tiny. Rex Collie! You hush. You hush! I like reset this. I go down here. No interrupting werewolf today? He's working. He might be home soon, though. He should be home soon. What's the last checkpoint? Let's restart. I think I screwed this up. There we go. Still waiting for the Dancing Tuck stream? You're gonna continue to wait. Streams live! Thanks for the follow. Welcome, Fobby Flock. Welcome in. We are dreaming. We are streaming our dream. Gotta be something I'm missing. Oh, here we go, here we go, here we go, here we go, here we go. Big brain, big brain. Big brain! Fire safety first.
Hello, my name is Dr. Glenn Pierce, and I'd like to thank you for triggering every single one of our
no
823
hints,
emergency protocols.
I'll figure it out.
This will assist us greatly in improving the system for future patients. Congratulations. Anyway, you're now headed in the right direction, and we should be able to initiate the emergency exit protocol shortly.
Neat. Make yourself as tiny as possible. This is pretty tiny. I'm pretty small. I believe your brain does not actually increase its size, but it does process logic and retain memories and working in order to at a reasonable mass and density. At least that's what I think. It doesn't actually get bigger. No, it just gets better at using the connections that it makes, and you make new connections with it, and it recognizes them. This. Wish I could be bigger. 5 to 6 streams is the absolute limit. What's the emergency protocol to the emergency protocol? Have more fire extinguishers. Meeting for Cardboard Lovers Association. Hey, all the cats! There you go. Agenda. Roll call. Oh, I didn't even. It wasn't. Whoa, we're loading so many percentages. You look over and I'm nude? Yeah. I am. Oh boy, 3 a.m. Greetings to phone. Thanks for the follow. Welcome to Fobby Flock. Welcome in. Do I do much reading?
Emergency exit protocol
Not as often
initiated.
as I should.
Please prepare to conclude your Somnasculpt experience in 10, 9.
Oh wait, I'm not
8.
ready. No. Oh,
Error
okay.
logged by.
Orientation protocol.
Stand by for analysis.
Who wants a Krabby Patty at 3 a.m.? Oh boy, 3 a.m.
Error analysis complete. You are exhibiting signs consistent with an increase in fear, hopelessness, and frustration.
Yeah, I'm actually pretty calm.
This is inconceivable, as Somnasculpt therapy is proven to correlate with a decrease in these emotions.
Grape jelly. That is not jelly. That's blood. I know blood. That's blood. I also know soda.
Woohoo! Just
Thanks for the host. Oh, it's gonna break.
Hypothesis. Patient was improperly oriented. Conclusion. Impossible. Reformulating. Improved hypothesis. Patient requires additional Somnasculpt therapy. Conclusion. Emergency exit protocol cannot proceed.
Oh,
Emergency exit protocol has been emergency destroyed.
That's pleasant.
Instruction. Continue with Somnasculpt therapy indefinitely on an independent basis, as all orientation resources have been exhausted. This concludes your standard orientation protocol. Goodbye.
Whoa, what? Krakow, I don't say pop. Damn it. Yuzu. Now! Oh god, what's gonna happen? Trapped. What? Priorities first. What do you call the process of deflating a balloon with a sharp object? Yeah. I know what you want me to. I know what you want me to. Nice try! Oh, here it is. God damn it! Oh, hey, that's closed off now. I just want to go back to bed. I just want to wake up. I don't. That was pretty neat. That was really neat. Amazing, thank you, but please, no hints. I'll figure it out. I'll figure it out. I'll figure it out. No, if I want a hint, I'll ask.
Hello, my name is Dr. Glenn Pierce. Thank you for completing the Somnosculpt Standard Orientation Protocol.
I came in like
Before
a
we begin the first phase of therapy,
tux.
What'd you get me? Oh, wait, what'd you get me? Tux! Tux just pops in here, sings, takes over the stream, gives me coffee, and doesn't tell me what he got me. Something from Duncan. Smells like coffee. Taste it. Food? No, he got me coffee. Ooh. That's good. It's like a hazelnut latte, maybe? Babe, what is this? What is
And
it?
I don't wanna ever lose.
And you got me don't. What the hell? Wait, what flavor is this? What is this? Gingerbread latte. And he got me donut holes. Holy freaking crap, guys. Oh. Huck's got me donuts and coffee. Oh my god. Oh my freaking god. You know, you can't ask.
I'd like to briefly describe
better
the
werewolf.
finite and fragile nature of the dream state.
Muffled collie voice because I'm munching on some donuts and drinking coffee. Remember that donut shop that was named Glazed Holes? Yes, I do remember that. I'm gonna eat another one of these donut holes. Hold on. Oh, oh hey, you can see my hand. Hmm? I already got that. All first responders live on coffee and carbs. It's true though. Easy energy and easy sugar. Ooh, ominous. Take another sip of this coffee. I got 2 more donut holes. Let's eat this guy. Mmm, so good. Oh god. Oh god, I'm falling! What the hell? Manifold Garden prepared me for this. Priorities. Oh, what does it say? Looked like it flashed something on there. A cube. It's just random images. Last donut hole. Hold on, guys. Last one. And see. Hux knows me so well. He knows that I don't like touching food and being on my computer. So he brought me donut holes in a bowl with a fork, so I don't have to touch them. I can just eat them. What? That's what he's just sticking his head in there. What? What? Thank you. Hey, wait. Hey, babe. Gone. He poked his head in. Said he what? He's back. Thank you for the donut holes and coffee. It was nice. Love you. Thank you. Mwah. Yeah, I know you're not wearing a shirt. I can see you. Not wearing a shirt, guys. He felt like he needed to announce that to the world. Alright. We broke the dream state.
Oh wow, ow, 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 ow.
Wow, ow. Proster, thanks for the 100 bits. Thanks for making Tux dance. Look at that werewolf. Speaking of Tux, look at him. Quality. Insulting him? Why would I insult him?
Of course, nothing is more challenging than the difficulty of changing perspective, of fundamentally altering your perceptions in a way that will enable you to face dire, trial-by-fire scenarios with solutions that could not be found otherwise.
Not always Krakow. I don't have to be so angry. Whoa, what? Oh my god. Ah! What in the hell is going on here? What? Oh. His music bops though. Wait, what? Where did it go? Where'd my cube go? It disappeared. Oh, it's up there. Can't let them have fire suppression. Must be no fire suppression allowed in this facility. Oh, come on.
Finally, while we respect the unique progress of every patient, you must understand that it is possible to completely exhaust your supply of dreams, thereby entering a state in which you will not be able to wake up, even with the help of triggering mechanisms.
Is that what's going on now? Are we stuck in our dreams?
Wake up, 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 wake up.
Wait, what the hell? Wake up! Grab a brush, put a little makeup. I don't know how the rest of that song goes. Dude, Trip, thanks for 10 bits. I'm gonna jump on the bed. Yes! Get my paws all up on that. Yeah, what? What in the hell's going on here? More coffee. More coffee! Alright, so I'm gonna go the other way. God damn it! Can we? Perception is reality. This is how we die, guys. Oh wait, is this hell?
Please listen carefully for the sound of an alarm clock, which will automatically play if you are approaching a destabilizing dream weight.
Oh, that's weird. That is weird. I don't like that. I don't like that at all. That was weird. StareCon! Annual conference this week. Oh, what? Can we... Oh. Can you imagine this game in VR? How trippy this would be in VR? God damn it. What the hell did I just go through? Maze name, please. No spoilers. Please. It's the third time I'm asking you now. I got it. Let me play the game.
This is highly unusual. It appears you have entered the Somnasculpt diagnostic framework. Patients do not have access to this dream. Diagnostic warning. Unrealistic use of dream objects may result in dream integrity fail states.
Wait, what? Excuse you! What? VR is crazy. Too bad we couldn't watch you do it in VR as well. Can you stream? Yeah, I have. I've done VR streams. Done a couple of them now. Your music. There's something on top. Oh, that'll work. Jungo's Bistro.
Diagnostic warning. Paradox prevention protocols may not be fully implemented.
Take a quick sip. Hmm. Good coffee. Oh yeah, I saw something. What could I grab? Oh. That's a little awkward. We get some cat jams?
Diagnostic warning. Paradox prevention protocols may not be fully implemented.
Mean by that. That's what you mean by that.
Please paradox from creating any refrains. Explosive dream overload may result. Please paradox overload. Please overload for dream explosion. Conclusion dream overcall frame.
Bright. God, it's so bright. I think you get it in 10 minutes, you got it in 10 seconds. Yes, I did it. Not an exit. Well, you know what? That looks like something someone would say when you are an exit. My eyes!
Hello, my name is Dr. Glenn Pierce, and many years ago, I had a dream. I found myself in a place where I understood that each of us begins as nothing, where everything I perceived.
Mayonnaise, I've told you like 3 times to not give spoilers, please. Time you out for that, because I've asked you like 3 or 4 times not to give spoilers,
exactly the
and
way
yet
I
you
wanted
continue
to
do it.
White space.
Look at it go! Yes! Game is trippy. Yeah, this is fun. I've enjoyed this. Take me! Take me into the light! Now! My eternal salvation!
Name this reference. The end is never, 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 the end.
Is that Stanley Parable, maybe? I don't remember. Stanley Parable? Would be my guess. Ah! Why do they always leave the trippy stuff to the end? Because they gotta lure you into a false sense of thinking you understand what's going on, and then they just slap you with the trippy stuff. Come on! Come on! No! What? Oh. Okay. Wait, what?
But in white space, I also faced the greatest challenge I could imagine. Because with a lifetime of life itself behind me, and all of the weight that it carried, I realized that seeing things the way I wanted to was not as easy as it used to be.
Huh. I don't really know what's going on here. Am I dead? Oh! I guess we just keep going around in circles till it ends, huh? Oh.
You're well beyond dreaming now, and further out than anyone has ever come back from. But we hope that you won't get discouraged. After all, if this is a place of pure perspective, isn't it also a place where a different point of view could make anything possible? Isn't that why you came here?
Game is a bit of a mind. Yeah, it is. It is. Trippy game going around in circles reminds me of Layers of Fear. Have you ever played that? I have not. Oh, that's cool. No, no, no! IDK, my BFF Jill. Juiceps! You got the juice. Pressing ya, pressing ya. Ba-da-ba-da. Ba-da-ba-da. What's up, Juice? Does this put me back to the top? I bet it does. Oh, it does nothing. Gotta be a trick to this puzzle. Oh. There it goes. Ah, cheese wedge. It's a circle. It is! It's the resident cheese wedge. Whoa! Oh! Oh, that's not good. Oh, that's like nauseating. I don't like that at all. I am the alarm clock, oh god! Oh boy, 8 a.m. Oh, this has been fun. Oh boy, 8 a.m. Wait.
Hello, my name is Dr. Glenn Pierce, and by now you may have realized that all of this has happened exactly the way it was supposed to. You see, everyone who comes to the Institute does so because they feel that they are no longer in control of something important to them. But more often than not, the problem is not that the problems we face can't be solved. The problem is that we become so afraid of failure that we refuse to see our problems from a new perspective.
Ah.
And so, we do the same things again and again and again. And therein, of course, we find exactly the failure we were looking for. Your life will always be a struggle, and you will always have problems. But today, you have the chance to see things differently. Even though it meant facing obstacles that seemed impossible at first, you thought outside the box, and you overcame them. Because you saw things from every angle, you understood them for what they really were. Because you kept moving forward, no matter how far off the path you were told you were headed, or how unexpected it became, you found your way. In a few minutes, you'll be back in the real world, and some part of you will say that none of this was real. So how could it have really meant anything? But just like the power of perspective itself, it will have been as real as you believed it to be. All you've got to do is wake up.
I really enjoyed that game. Fantastic. That ending was good too. Oh. Ooh, this is a bop. Agner, thanks for the follow. Welcome to the Follow Me Flock. Oh, another fun game. Another good one down. Some feels at the end there. Some things to think about. Oh, extra mode. Challenge mode, developer commentary, Somnoscope workshop. Cool. There are like extra puzzles. Good to know. But I'm gonna end it. I think that's a good place to stop streaming. Finish the game. Get ready to make some dinner for Tux and I. Wow.
Who is a good smart collie? Cinder is. Yes, he is. Tux owes you a good pat.
Is it me? Am I the smart collie? Is it me? Is it me? Oh God, I hope it's me. Is it me? It is me. Ah! No, thanks for the 100 bits. I appreciate it. Let's see, who can we raid? Who should we raid, guys? Radium's streaming. He was in here earlier. Are you Tux's little pog champ? Yeah, I guess you could say I'm his little pog champ. What's the next game you have on your list is going to be the Turing test. We'll start it tomorrow. I'll stream again tomorrow. We'll play some Turing test. We'll get started with that game. Laughing started streaming Cyberpunk 2020. Great Chico!
I just got back from the store. Are we still doing the
Oh my God! There's so many. Rich Chico, thanks for the 10 bits. I heard the 100 bits. I appreciate it. And thanks for all the you guys want to go watch Laugh and play Cyberpunk? You guys want to do that? Do you want to go watch Laugh and play Cyberpunk? I don't know if you guys are interested. That game seems like it's been getting beat to death recently, but it's either going to be that or I was thinking about raiding Radium Desu since they were in here earlier. Spoilers? Let's go raid Radium then. That's what I was going to do first. Oh God, the
yes.
elves! Okay, guys. Once you flop, you just can't stop. Let's go show Radium Desu some love. I'll be back tomorrow. We're gonna start the Turing test. I'll come up with a new lecture, and then I'll see you guys tomorrow. Thanks for hanging out today, guys. It was fun. I hope the lecture was well. I hope you guys enjoyed the ending of Superliminal. I will see you guys tomorrow. Thanks for the follows. Thanks for all the bits with the crazy text-to-speech copy pastas. Oh my God, it's killing me. Thanks for the subs. Thanks for the follows. You guys are freaking awesome. Guys, I will see you tomorrow. And until then. Wait, hold on. I gotta do this first. Let's hit up the discharge test. Make sure you have your insurance card ready. Copayment due at time and treatment. All that stupid stuff I always say at the end. Guys, I'll see you guys tomorrow. Until then, bye.